exciting evening in estimates. We will start with Senator Askew.
And I won't even go to Thriving Kids straight up now. Just got a quick question around the use of consultants. In the portfolio budget statements, it shows that nearly 80% of consulting for the actual Department of Health, Disability and Ageing is coming from the NDIA, or the savings, I should say. Can you confirm that $194 million anticipated to be saved for the department overall through reduced spending on consultants? Nearly 80% is from the NDIA, and that figure is on page 38 of the portfolio budget statement, and it shows that the NDIA departmental payments will be reduced by $153,425, which is about 80% of the total savings or payments.
So I'll ask Mr Head to comment. We did actually, normally this would be covered, the general consultants in the cross portfolio, which was done on Tuesday.
Sorry, I wasn't here.
So the officers that would normally deal with that are here. Obviously, I'm familiar with... sorry. I know the answer to this question.
Okay.
So this question was actually asked by Senator Ruston.
Oh, it has been covered?
And what this really is there's an existing measure that has an across-the-board cut in consultants and contractors across the public service. It's basically in proportion to your expenditure.
Right.
What this measure is, and the reason that there are dashes across the years out to 29-30, is the measure just extends that consultant and contracting by 1 year, because we've now brought 29-30 into the forward estimates. And if you look at our portfolio, and you particularly look at the administered expenses of the portfolio, the NDIA dominates. And
it obviously does.
Because it's by far the largest expenditure item within the portfolio that is actually administered by the Commonwealth, that's why the proportionate save on contractors and consultants is highest.
Okay. Did anyone else want to add on to that from that answer? Okay. What is the total NDIA spend on consultants, contractors and labour hire and non-wage expenses over the forward estimates?
Senator Sam Porter, Chief Operating Officer at the NDIA, we would not be able to provide you with a figure over the forward estimates.
Okay.
What we could provide you is expenditure to date this financial year and committed expenditure for consultancy contracts.
So you would obviously be budgeting for the forwards though?
Yes, that is true.
So would it be possible to get that on notice, if that's the case, just for the year to date for now, perhaps the last couple of years, the year to date for this year, and then the next 4, obviously, for that?
Happy to provide that on notice.
That would be great, thank you. I think that answers those questions. Do you want me to do my next one, Chair?
Please.
Okay. So this one's not to do with consultants. This is to do with deaf children. So I'm not sure who would want to answer these ones.
Yeah, deaf children. So maybe you start, and I'm sure the officers who know the area will come to the table. Thanks.
So I understand that First Voice has proposed a strategic reform to shift early intervention services for deaf children up to 0 to 4 from the NDIS to the Commonwealth Hearing Services program, which would then align with the Australian Government's Roadmap for Hearing Health, which is from 2019. So at the moment, I'm pretty sure that children under 4 are still remaining in the NDIS rather than being moved across to that service, which is already aligned and in place, I would imagine, under the Commonwealth Hearing Services program. Is there a reason for that hasn't been considered, or has been considered?
Now, again, one of the benefits or costs of being at estimates for 3 days this week is these same questions were asked on Wednesday.
Right.
and answered by Hearing Australia.
Excellent.
And I'm just trying to recall what the answer is, and I feel the answer is that they're staying within the NDIS at this point in time.
Okay.
So there has been, I think, some discussion of that, but there is no change in movement of those, of the 0 to 4s at this point in time.
So it sort of just seems like it would be a logical way if we are sort of trying to divest from the NDIA, whether or not that was a possibility to look at that. But it sounds like those questions have already been covered in my absence, so I apologise for that.
So I just directed to the Hansard because
yeah.
it got answered a number of times, and I would probably detract from the quality of those answers if I went further.
That's not a problem. I'll have a look on that. But yeah, sorry I wasn't here earlier in the week to get those. Thank you. Let him go.
Okay, we'll go to Senator Roberts.
Thank you, Chair. NDIS. Is the agency aware of the investigative series into NDIS fraud produced by independent journalists Pete Zagoulas and Drew Pavlov, reporting that has reportedly exceeded 2 million views on YouTube and more than 100 million views across other platforms? Has the agency reviewed these investigations and have any audits, compliance actions or referrals to police or the CDPP been commenced as a direct result of the matters they raised?
Senator, thank you for your question. John Dardo, Deputy CEO, NDIA. We clearly cannot comment on individual cases, so I won't respond at an individual level in relation to that case. But what I would say at a broader system level is that there are, as I've previously stated in these hearings, there's been thousands of providers that we've identified and removed. In some cases, those providers have been removed through actions that are in the public domain, and you can find them in the public domain because there are administrator reports or there are prosecution outcomes or convictions. Then there are actions where we've removed them because we've implemented manual payment reviews, and when we implement those manual payment reviews, that may not be in the public domain, but that's still thousands of providers that have been treated through those actions where we've reduced their ability to claim without us vetting the claims. Then there would be investigations where we've executed search warrants where they may not be in the public domain, and again, members of the public would not know that we've done those warrants. And then there would be cases where investigations are ongoing or prosecutions are imminent or other interventions have occurred that are not in the public domain. So all at a broad level, what I can say is we can't comment on that case, but there would be no way for any of the people that you've referred to know what we have or have not done in that case, other than the fact that there are some things in the public domain that they have seen or pointed to that we had already actioned well before those videos were produced.
Has the NDIS launched any internal investigations in response to this reporting that I specified, in particular into Jamal Sabsabi, Joseph Youssef, Marcia de Menez?
Senator Roberts, the official has already said that he won't be commenting on individual cases.
I'll put the questions on notice then, because they're replete with specific cases.
Fair enough. Do you have anything else then, Senator Roberts?
No, I don't.
Okay, we'll go to Senator
Thank you, Mr. Dada. Thank you for your succinct answers too.
Thank you.
Thanks very much, Chair. All right, so we'll pick back up on with the bill. and just seeking to get some clarification on it. Now, one of the changes under the new legislation is that the Minister will be able to prescribe particular treatments for particular disabilities in order for people with those disabilities to get access. Going back to the example that I gave a bit earlier, what treatment would you potentially be enabled to propose for somebody with autism? Not bearing in mind, I understand the positions that you've put forward, the Senior Minister and the head of the agency, in relation to your view on the topic, but this is legislation that can be used by a party or a minister of any stripe or determination. So, yeah, what treatment could be proposed for, say, an impairment like autism, if that was how the agency wanted to frame it, under the legislation as written?
Erin Rule, Acting First Assistant Secretary, NDI Strategy and Policy Division. Minister, I've done it again. Senator. Apologies.
I mean, I'm not complaining, but I think something really radical will have had to change if that ever occurs.
Senator, that aspect of the bill is will be provided for with Category D rules.
Yeah.
So we will be consulting on that part of the bill to inform the types of treatments that will be listed in that. So we're not in a position to provide detail on that tonight.
So they'll be, yes, they'll be considered as Category D rules. But remind us, Category D rules don't require consent of the states or territories, do they?
We are required, well, there's a consultation process with them. Yes,
but they don't require approval from the states or territories.
Correct.
So it's a rule that the Commonwealth Government can make.
That's correct.
Yes. So within the legislation then, as you've drafted, because I should probably test this, it is correct to say that the bill, one of the changes in the legislation is that it will grant the Minister the ability to prescribe particular treatments for particular disabilities in order for people with those disabilities to gain access, correct?
I haven't got it open in front of me to say whether that's the exact... thank you.
Sarah Hawke speaking. Senator, can I just clarify your question?
Yes, so I'll ask it again. So one of the changes under the new legislation is that the Minister will be able to prescribe a particular treatment or treatments for particular disabilities in order for people with those disabilities to get access to the scheme, correct?
That's not quite correct, Senator. The purpose of the Category D rules is to clarify what treatment won't be required for consideration as part of the agency determining whether a participant meets the permanence requirements for access.
I think we might be talking at cross purposes, because I understand that was what we were talking about before the break. There is also then another section within the legislation as you've published it, which grants the Minister, in addition to those definitions of what an appropriate treatment may or may not be, that the Minister may also prescribe particular treatments for particular disabilities in order for those people with disabilities to get access. So it's two different things there.
It may assist officials. I think you're reading from either the ledge or a briefing document. If you've got the page number or reference, so that we can all make sure we are in fact literally on the same page.
It is in the changes to permanence. No, I don't have the page number referenced. I only have the text. The pieces we were talking about before were appropriate treatment for a person's impairment or impairments, which I believe is item 93 listed in the explanatory memorandum or around there.
Yes. 91 and 92, I think.
Nearly, yes. But it is in that section of the legislation. I can't recall it off the top of my head. But look, if you can confirm for us tonight that as far as you understand it this evening, there is no power to the minister granted in the proposed legislation that would enable the minister to prescribe particular treatments for particular groups of disabled people for the purpose of access, that is useful.
Yes, that's correct, Senator.
Okay.
So the rule-making power enables the rules to be made to, in effect, deem that a person has undertaken all appropriate treatment. So, for example, I believe there was an example, I think, in the explanatory memorandum that was to the effect that a person with a hearing impairment might not be required to pursue a cochlear implant.
Yes.
Yes.
Yes. So you have the power there to prescribe that certain treatments are not
required to be
Yes.
considered as part of determining whether someone meets the permanence criteria.
But your interpretation is that you do not also have the power to proactively prescribe. Is that
correct?
My understanding?
Yes.
Okay. Well, we've got a bit of time. I'll go back and have a look through my notes for this question. If I find anything, I'll bring it back to you. In terms of the support determinations powers within the legislation, so as we've talked a bit earlier, with support determinations that can reduce funding for groups of supports by a certain percentage, for example, 50% reductions for social and community participation funding. The explanatory memorandum says, and I've got the quote directly for this one, funding for some NDIS supports may be less than the actual cost of providing or acquiring the support, while still being reasonable and necessary. And that's page 30 of the explanatory memorandum. Now, we've spoken about this before, and we've talked specifically about whether this will enable gap fees to be paid where funding for supports is lower than the cost of delivering those supports. Can I now clarify whether this section of the bill does in fact enable gap fees?
It's Sarah Hawke speaking. It's not unlike Medicare, or it's not a gap fee situation. Essentially, the determination to reduce, for example, access to social and community participation, that group of supports, it's a determination that will be the amount of funding, and the participant has the choice and control in relation to how they choose to spend the funding within the limit. So it's not a situation where, for example, the cost of a wheelchair is $10,000 and a person receives $8,000 for it, which creates that gap. It's an amount of funding that is reduced to enable a participant to operate within the reduced amount of funding in terms of how they engage, how they choose to use the community access supports in relation to choose the choice of provider and the choice of activities that they undertake within the amount of funding that's allocated.
I understand that, Ms. Hawke, you're talking about how the government has flagged it intends to use that determination
yes.
to reduce the social and community participation funding line items. It is correct, however, to say that the power granted in the bill is not constrained to social and community participation, is it? It could be used for other areas of participant funding. Is that correct?
Yes.
Yes, that's correct. You've used the example of a wheelchair to say that's not what is intended by the government. But there's nothing in the legislation that prevents a minister or the minister making a determination in relation to assistive technology, is there?
Senator, Mary Wood speaking, Deputy Secretary, Disability and Carers Group in the department. It's probably just worthwhile to highlight that the determination would be for a group of support. So it's not going to be for an item such as a wheelchair, for instance. It's very much about the power of the minister, if this provision passes Parliament, to determine that X amount for a group of supports is reasonable. So obviously then the participant gets to choose how to spend that reduced funding in the category.
I understand that, but I'm just... So you're saying not a particular wheelchair, but assistive technology is a group of supports, so that this determination could be applied to assistive technology, correct?
I'm probably going beyond my knowledge about what the taxonomy of group of supports is, but certainly by the support category, yes, there is a proposed power for the minister to be able to determine that a support category can be reduced.
If I can add to Ms Wood's answer, Erin Rule speaking, I would note that the bill does stipulate that the minister must consider the safety safety of participants when making the determination. So that would be germane to the types of categories that this could apply to.
Given that the language is, as I've quoted, that funding for some NDIS supports may be less than the actual cost of providing or acquiring the support while still being reasonable and necessary. If a participant is currently being funded for a support and the determination from the minister is a level of funding that is less than is currently required, currently expected for that level of support, the difference between the level of funding and the payment needed will have to be filled by the participant, correct?
Senator, if the individual participant decides that it's still very valuable to them to purchase a certain service or product, that will be the choice they can make, and their budget will be as determined by their package with the imposition of determination, if that's how a future or current or future minister decides to proceed.
Yeah, so there'll be a gap fee.
Or I think what Ms Wood's saying, or they choose to use less supports. And the minister having had to regard to the safety of the participant before making that reduction in the class of supports.
I really struggle to see how that is any different than the Medicare benefit scheme that we're talking. I mean, that's literally textbook how it works. There are certain specialist items that you can claim. There are certain items you can claim throughout the Medicare system. Some of them cover the entire cost of the interaction with the healthcare professional. Others cover part of the way there. The rest is a gap fee. Minister, we've spoken about this privately. That is a dictionary definition of a gap fee.
No, Senator, and I think the answer lies in the response that was provided to you by Ms Ward. Because the determination, if you think about a participant's budget, applies to a group of supports, it's not applied at the individual level. And so in the example that we are actively contemplating as a government, which is a reduction to social and community participation budgets, this is essentially allows substitution, would allow a participant to choose how to deploy that budget against the elements of that budget that were of the highest priority to them. Which I accept is not a position that you agree with or would advocate for in the Parliament. But it is not intended to create a gap fee, which I think is the question that you're asking us.
So can you, Minister, can you just clarify for the committee then this evening the difference as you see it between what you're proposing and the gaps that exist in the Medicare system between the level of rebate that is provided by Medicare and the service charge of, say, a psychologist or a psychiatrist?
Senator, because the government's proposal is to apply this to social and community participation, and we don't expect that it will generate a gap fee.
You don't expect that it'll generate a gap fee?
No.
Because people will just default to, they'll just give up the services that are no longer able to be...
I think that you... I mean, I will ask officials to step through it again, but essentially it's incorrect to understand this as applying to the individual item or the individual's service, and that is what is generating the confusion.
But the service is funded within... the service is categorised by the agency as a type of support, and the determination is being applied to the type of support. So while you're not making a determination with the specific support service provider listed or necessarily the particular type of therapy or whatever that might fall below the determination, effectively you are setting you are stating in this legislation the amount that you will provide for that type of support need not be as much as that support actually costs to deliver, leaving the participant to choose either to give up the vital support or pay for it themselves.
If I can perhaps add, Senator, it's Mary Wood speaking. It's not envisaged that support determinations could create a gap fee that any participants will be required to pay, because participants will have a budget, and the determination can't change the size of their budget midway during their plan. So they will simply have a budget and they can spend it as they see fit. So if that means that it's very important to a participant not to incur any private expenses, if you like, then they can reduce that service, or they can attempt to negotiate with their provider on how to use the budget and get the most out of their supports.
I think we're going to pick this back up during the course of this legislative discussion, but I'm also conscious of the time, and I need to get a bit of clarity around what this determination looks like at the individual level. So can I ask about what the determinations will look like when it comes to an individual's plan, as in will people's plans be updated to reflect the lower funding available for these supports? Will everyone receiving social and community participation funding be given a new plan when the determination comes into place?
Perhaps Senator Ms Rule might want to comment, but the way we'd envisage the SCCP reduction occurring would be progressively from the 1st of October. So as a person's plan comes up for renewal or lapses generally on an annual basis, then the reduction in the amount for social and community participation will apply for the next year of the plan. So we wouldn't be envisaging that you would be halfway through your plan period and then your plan amount for SCCP would change. We're envisaging that as plans come for renewal, they are updated with the lower amount of supports for SCCP. So there'll be a rolling pattern of this being implemented.
So be a roll. I'm really sorry, it might be the lateness of the hour, but yeah. So you're implementing these changes, you're envisaging a ministerial determination that implements these reductions in tranches, is that correct?
That's correct.
All right. and the tranche will begin in October.
1st of October.
1st of October and conclude in...
The vast majority would be concluded 12 months later. There may be a small number of plans that go beyond that.
Right, okay.
And we're going to rotate the call in a moment. Senator Steele, John, if you'd like to...
Yes. Yep.
Perhaps
out.
Before you go to your next question, perhaps I'll add as well that this could also occur at a plan reassessment. So at a new plan from 1 October, a plan reassessment, or at time of plan renewal, that element won't commence until February 2027, the plan renewal process.
And so as a group of participants comes within a tranche where this reduction takes place, they will then have to make the choice whether or not to pay a co-payment or a gap, pay the gap between what the agency is then willing to pay and what the provider has previously been being paid for.
Senator, I'm not sure we characterise it as a gap fee. The way we've conceived the policy is consistent with how budgets operate at the moment, which is that participants are given a budget, and as we've said, that the support determination cannot take effect partway through a new plan, so no one's going to be caught short. The participant will be given a budget that's consistent with the determination, and they can make decisions about what they value the most in respect of the activities funded in that support category.
Yeah, but one of the decisions they could make is to cover the gap between what the agency will fund and what the provider requires. Yeah.
Well, in that case, I think we just characterise it as the participant's budget as per now applies to a certain level, and if the participant wants to spend on activities over and above that budget, yes, they pay for it through other means.
I'll leave it there and rotate, Jay.
Thank you. Senator Askew.
Now we'll go to Thriving Kids, if that's okay.
Senator Gabriella Pulczynski, First Assistant Secretary, Thriving Kids Task Force.
Thank you very much for being so patient today. It's been a long day already. We'll get there. Okay, so just touching on the rollout or the preparation for moving over to Thriving Kids. So, and given the change to functional assessments, how will the government define which children are eligible for Thriving Kids support, and what thresholds or assessment tools will be used?
So firstly, it's important to note that a diagnosis isn't required for Thriving Kids. It is intended to move towards a more functional assessment approach. So there are also two types of supports under Thriving Kids. The first being general, so general information and advice and parenting supports, and the second being targeted supports, which are being delivered by states and territories. And take the form, for example, of one-on-one or group therapy supports. So in relation to who will get those targeted supports, that's work that we're doing at the moment with states and territories. It has started in the last month and will continue, and that aims to identify and inform their triaging, needs identification and prioritisation for October.
If I can add to that, Senator, it's Mary Wood speaking. My colleague spoke to the ways that kids can access the Thriving Kids services, but it's probably just worth noting that all governments have agreed in principle to NDIS access reforms to support the rollout of Thriving Kids, which is obviously the complement of the Thriving Kids program. So the Commonwealth is working together with state and territory governments to define low to moderate support needs to enable nationally consistent needs identification and triage approaches, and that work will be considered as part of the substantially reduced functional capacity work that the TAG, the Technical Advisory Group, is considering.
Okay.
I mean, perhaps just, I don't want to have three voices, but when this was negotiated with the states and territories and Thriving Kids was first envisaged, there was a strong desire to not have very rigid gateways to get into the system, to move the children into commission services as quickly as possible, and then there would be, in fact, some triage once they were in the system. Now, the unknown, the issue that we're working through with the states and territories is, what level of demand will there be for those services, and therefore how much active, gatekeeping would there have to be on the way in. But certainly the intention from a Commonwealth perspective was to have those barriers as low as possible to get into a system, because we did want to have as early as intervention as possible through programs that would be run in natural settings as much as possible, in group settings, which is obviously not only good for children, that's what the advice says, but is also a more cost-effective way of delivering those assistance. And then once the children are in that, you would then also be able to work out, is this the right level of assistance and care required? And that's the kind of model which the Oberclade Committee certainly recommended and is available in their public report.
But so there is an implementation model available, is there?
So the Oberclade Committee report is what was a very good piece of work, provides a template and guidance. It is the case that we are working with states and territories as to how they'll implement it in each of their jurisdictions, and it is likely that won't be absolutely uniform, partly because it's building on different starting points in each state and territories, but we would see that as a good template to work through, and that's what we're working through in the Thriving Kids area.
You're reading my questions. The next one was about uniformity across the states. So how do we, obviously, as you say, each state will have different levels of preparedness as we go into this. How do we actually ensure that the services that are provided are still maintained at the correct level for the children involved?
So the agreement architecture for Thriving Kids includes, in the National Agreement for Foundational Supports, service principles and roles and responsibilities for each jurisdiction as well, that all jurisdictions have signed up to. It does accommodate for variety in each jurisdiction intentionally, noting that Thriving Kids is meant to be delivered in areas where children live, learn and play, and build on existing state services. And so that's part of the design of the model, but the national model is outlined in the agreement architecture. And part of that as well includes requirements for jurisdictions to share implementation plans with the Commonwealth to demonstrate how their services and supports will comply with the national model. And the Commonwealth has to accept that.
And so is there some sort of, I might say punishment, some sort of impact if they don't deliver what's being expected in according with the agreement?
So in the bilateral agreement, there's, pardon me, there are milestones that need to be met to a satisfactory level for the Commonwealth to then pay jurisdictions.
Okay, no worries.
And there are ongoing reporting obligations in the heads of agreement as well, which will be negotiated with states and territories, so that we can have a confidence from a Commonwealth perspective that the funds are being dispersed and the programs are being rolled out as was required as part of the overarching health and disability deal.
Okay. The rollout, or the start date's already been pushed back to the 1st of October. Are we on track to actually deliver that start date?
Yes,
Definitely.
we're on track to commence from October.
Yep, October the 1st, yep. And how will it interface with the NDIS, particularly those kids who are just borderline or transitioning between the systems?
So this touches on some of the earlier work that we started with in talking about the assessment approach, as Ms Wood outlined, being the work that we're doing at the moment with jurisdictions on the low to moderate definitions that will then be picked up by the work of the technical advisory group, which will then also inform which children are in the NDIS and have an assessment approach and assessment framework for those. It's important to note that this doesn't start until January 2028, and so children currently in the scheme will remain in the scheme. And in relation to children who are in the scheme before these changes commence, they will be grandfathered until the point that they turn 9.
They'll be grandfathered?
Until they turn 9.
Okay.
Until they what, sorry?
Turn 9.
Until they
the
turn
age of
9.
9.
Yeah, okay. And is there any measures in place to make sure that the Thriving Kids doesn't result in children being turned away from the NDIS when they actually should be perhaps considered for higher intensity supports?
Senator,
The assessment, the
the
eligibility for the NDIS is not related at all to whether someone is participating in Thriving Kids.
Okay.
So if you participate in Thriving Kids, it's not, for example, therefore you
one or
can't
the
apply.
other.
It's not one or other.
Okay.
There was some discussions in the with the states and territories almost the other way, where states and territories said if you're receiving assistance under the NDIS, you shouldn't get access to Thriving Kids. That's not where the agreement ended up. Okay. It just left the flexibility to parents, because you could imagine someone might have an NDIS package, but they might also think that some of the commission services available under Thriving Kids would be very beneficial for their children. Yeah. Now, some states and territories are concerned about how they will ration if there's excess demand, and so they may think about that, but the agreement actually is clear that you can be in both systems.
It's good to know. I didn't realise that.
Senator, if I could just add to that, just to confirm that, of course, the decision about whether a child has low to moderate support needs and is eligible for the NDIS will continue to be an agency decision. So, as the Secretary said, that's not connected with any Thriving Kids services that they might, or that the parents might seek to access.
But you wouldn't think that it would be a huge percentage of children that would be in both, but just that that service is available if required. Okay. So what proportion of the funding under Thriving Kids will be directed to frontline service delivery versus admin, program design, intergovernmental coordination? Have you got those sort of statistics?
So part of the bilateral agreements, it required jurisdictions to indicate at a high level what proportion of funding would be directed to targeted supports. That is at a very, very high level, and roughly 50% will be will be directed to targeted supports. I'd have to get the numbers, but in terms of the other funds allocated to Thriving Kids, it's a very small number, but I'd have to confirm it. That is actually administrative. Because the Commonwealth is also investing in measures, for example, like the MBS health check, facilitation of Thriving Kids in EC settings, National Digital Child Health Record, and also information, advice and navigation services, and also services for parents like peer support.
Okay.
Senator, just to add to that answer, that the Commonwealth has invested $27.3 million in the design and consultation of Thriving Kids and related early childhood reforms. $19.2 million of that went to the Department of Social Services, which is now, that part of DSS is now with the department that Secretary Comley leads, and that was for foundational supports design, and then $8.1 million, the balance of that total 27.3 went to the NDIA to support best practice early childhood supports outside the NDIS. So that's 27.3 million, if you like, for what I suspect you're referring to as administration costs to the Commonwealth.
Program design, okay, thank you. So what consultation has occurred with families, carers, early childhood educators and disability organisations in the design of Thriving Kids?
So firstly, Thriving Kids builds on the work of the NDIS review, which heard from a number of family and sex representatives about the need for an approach that was different to the NDIS model. Similarly, the Thriving Kids Advisory Group that Minister Butler and Professor Oberclade led also had a number of engagements and consultations with representatives. As part of the task force in implementing Thriving Kids, we're engaging with a wide range of stakeholders as part of implementation, including for the Commonwealth measures. So we are attending dedicated forums, for example, speaking with the NDIS Reform Advisory Committee, disability representative organisations, the NDIS Advisory Council and Committees, and the NDIS Children's Expert Advisory Group. We're also engaging with organisations representing the autistic community. We also have engagements across education and health-related forums. So, for example, the Early Childhood Policy Group, Schools Policy Group, and the General Practitioner Reference Group. We also are engaging with First Nations representative orgs, including Nacho and Snake, and also have a number of targeted engagements with early childhood education, disability and health experts and academics.
Extensive. Would you be able to table that list?
Certainly. I might also add that part of the $600 million investment by the Commonwealth will also go to engaging an autism-led or autistic-focused organisation to work with us on the measures that we develop, the resources that we develop, and to feed into the implementation of Thriving Kids.
Can I also comment, Senator, that there was a parliamentary inquiry led by Dr Freelander and Dr Ryan that was run late last year into Thriving Kids. I don't have the up-to-date number, but certainly when they presented to the Oberclade and Butler Committee in November, they'd already received 400 submissions, and I have a feeling they received another couple of hundred more than that, and they held a number of public hearings which came in. So the designing Thriving Kids has been informed both, as was commented, by the earlier work of the Monaghan and Paul review, the work of the Oberclade Committee and the Parliamentary Committee, and the processes that have just been referred to.
That's good.
Senator, just to be precise, further to the Secretary's comments, the parliamentary inquiry received 1,194 survey responses.
Pretty impressive. So you mentioned before that the agreements are all in place with the state and territories. Is it possible to get copies of those agreements?
They're publicly available
They are
on the Federal Financial Relations site.
Okay, no worries. Very good. I note in the first part of Mr Butler's response to a House of Reps question on notice, which I've got a copy of here, he stated that the specific number of children and their families, carers and kin who will be supported through Thriving Kids is difficult to estimate, particularly as service design is ongoing. Have we come to more realistic numbers since then? That was only recently, actually. We got an idea of what sort of numbers we're looking at?
So there are two parts to this answer. The first being that the number of children that will be serviced through Thriving Kids also includes children who currently are not serviced through the NDIS. So Thriving Kids is also about servicing unmet need and not only supporting children but also parents and families and carers. So that's just important to note that ultimately, as Minister Butler mentioned in that con, it is still difficult to estimate because we are still working through service design with jurisdictions, and so there'll be some time before we know the numbers going through Thriving Kids. We're working on an evaluation reporting framework that in time we'll know that, but we just won't know that right now. We do have some more specific numbers though about the estimated number of diversions from the NDIS into Thriving Kids.
Okay. Are you able to provide those numbers?
I can, and Ms Long may also choose to speak to it. There's some assumptions that the scheme actuary has made based on his modelling as part of the budget.
So Anthea Long, NDIS Sustainability Task Force. So
Yes, as part of the budget and as part of the modelling and work that we did for the budget context, there was, given the decision around Thriving Kids in terms of the agreement with states and territories in 1 January, where there was an agreement around access changes for children aged 8 and under in order to enable Thriving Kids. And so as part of that modelling, we did look at the numbers of diversions from the NDIS. So as Ms Porczynski said, this is not about the total number of children that may access Thriving Kids. It was purely looking at what the diversions may be in terms of children that would no longer be eligible. And it's also worth noting, as we mentioned previously, that children 0 to 8 would not be exited as a result. Yeah, that's right. So in terms of the total number of diversions estimated, and obviously it increases over time, but it would be looking at cumulatively up to 2030-31, it would be 92,000.
92,000.
However, I would stress these are preliminary estimates because there is a range of work to be done around working through with the states and territories and with others around what those actual eligibility changes would look like and what that threshold would be. So I really should stress these are very preliminary results and there is considerable work to be done.
So you mentioned the modelling that was done. Is that publicly available around those?
So yes,
in preparation for the budget?
Through the order of production of documents that we have discussed, that modelling is available. And I think I can give the OPD number to you if that's helpful. So it's 504, 506 and 508. But as part of that modelling, there is some information around the impacts on participants over the forward estimates. Which shows both the pre-reform, what the projections of participants would be, and then post-reform, what the participants would be in terms of the total numbers. So that's all contained in that, the pre and post? That's in the OPD, that's correct.
Excellent. Just out of interest, if there's 92,000 cumulative to the 2031 that will be removed from it, what would the total number of children up to the age of 8 be normally on the NDIS? Is that's not removing everyone, so we must
sorry,
still
just to be clear, they wouldn't be removed from the NDIS.
Yeah,
this is around children who would not be eligible, who hadn't got onto the scheme.
Right.
Senator Merrywood speaking. I think I can help a little bit with the contextual figures you're after. So as at the end of December last year, there were almost 70,000 kids under 9 in the NDIS with developmental delay. That's the figure, is 69,878 children under 9. And then a further almost 60,000 with a primary disability of autism. But of course, that doesn't break down, that primary disability of autism isn't broken down into mild to moderate support needs or higher support needs.
No, that's fine. That just gives a bit of context. You're quite right. Okay, so the modelling that will show, because the question I had there was how can you budget for a scheme without numbers, but if you've got the modelling there, that will give us an idea on how that's been developed, so that's very good. Thank you.
And we will need to rotate the call, Senator Askew.
Okay, I'll come back to that one.
Great.
Thank you.
Senator Stilton.
Thanks, Chair. So just moving back to the determinations pieces we were talking about previously, I'm interested to know administratively from an agency point of view. So we've heard that these cuts will be implemented in tranches. So how will the NDIA manage the administration of this beginning in October? Will there be a delay in issuing those plans? I would imagine there would be hundreds of thousands of them affected in each tranche.
Hi, Senator. Scott McNaughton, Deputy CEO. This is something that we've got to work really closely with the department on, obviously, as we finalise the policy settings and the legislative settings. As my colleague said earlier, as is outlined in the explanatory memorandum, the legislation at the moment, any such change has to happen at the beginning of a new plan. So that's either a first plan, a reassessed plan, or a plan renewed. So at the moment, it would be from October this year, every time a planner would be doing a first plan, plan review or reassess plan, that's when that mechanism would commence. Then into next calendar year, depending on again, the timing, we'd be looking at doing other tranches. Now, we haven't worked through the detail of that, obviously, because there's a very live conversation with the legislation, but that's something we just need to work through the technical detail with the department over the coming weeks and months.
So this, so what I think I'm hearing is it correct to say that a participant that is within one of these tranches would be within the tranche at the beginning of their plan that would begin in October? Is that correct?
Yeah, so that's, as the legislation is currently conceived, it would be a plan would commence from a first plan or a plan reassess from that date. It would have that support category or support item in the plan, and that adjustment would be made post that, as part of that plan approval.
So it would be made post.
Well,
so as
plan,
and then you adjust.
It's a prospective application, not retrospective. So it's for a new plan as that plan is approved. So it happens prospectively.
Okay, and so in that kind of administrative version of the rollout, in that kind of vision for what the rollout looks like, that is effectively how you are proposing to manage preventing participants accidentally incurring debts because the reduction occurs somewhere mid in their cycle and they don't know.
That's correct, Senator.
Okay, so it won't be occurring kind of it won't be affecting people whose plans have already commenced. Is that what you're saying?
That's correct. It's not affecting in-flight plans. It's happening at a point in time a new plan moving forward is approved.
Okay. What do we do in a situation where somebody's plan, because the agency has in the past not signed people up, has enabled people to engage in multi-year plans, so 2, 3, 4, 5. How many people within the cohort that will be moved through the tranches have those multi-year plans?
We're still working that technical detail, Senator, with the department.
But how would
you're
we
absolutely
tackle
right.
that? You know,
well, part of the modelling is to look at how many participants are on extended plans, when those plans would be coming up for a renewal. The legislation also introduces the concept of a renewal, and when we do those renewals, and as I think Ms. Rule said earlier, there would be tranches of those into the following year. We just have to work through that technical detail post-legislation.
Okay, but just to clarify, the intention is to conclude this tranched process by what time was it next year? It'll be beginning October, then we conclude.
It's Erin Rule speaking, 1 October 2027.
27. So for anybody whose plan doesn't come up for renewal before that 27 date, you would be looking at cutting their plan short to be able to then begin a new plan under the new determination?
That's correct, Senator. That's there are provisions for that in Part 5 of the bill, in the plan renewal part of the bill. There is an administrative feature that enables longer plans to be brought forward for plan renewal in tranches, as Mr McNaughton has said.
And how many participants do we anticipate are going to be affected by this determination, numbers-wise?
I don't think I have that number.
I just confirm, Senator, is your question how many participants in plan is after the 1st of October 2027?
No, a little bit back from that. So how many participants what's the... God, it's getting too late. How many participants have currently within their plans social and community participation funding? What's that overall number?
That was in the impact assessment, which we tabled. The number from memory is around 390,000.
It's about 50%.
Yeah.
We'll get you the
52% of the scheme
plans
participants
have some of that amount.
Yes.
And what, because this is also going to impact capacity building, how many plans have this capacity building within them?
That is not on the top of my head, but I will look up the impact analysis.
I did have it, but it's moved around during the course of the day and it's no longer where I thought it was.
Senator, sorry, just to confirm your question, you're asking how many participants
Have
CBDA?
Yes, yes.
As at 31 December 2025, 752,454, or 99%.
Okay, that's an easier way to think of it. So we've got 390,000 in one pot and 99% in the other. Legislation as proposed would see, or government intention, rather, I should say, is to put all 390,000 through that tranched system within, from the 1st of October to the date you've given me in July 27, was it that the date? Or June 27?
1 October 2027.
So a year, a flat year. So in a year, we're going to go through 390,000 and then 99% of the participants between the two different types of funding. And we've, to avoid the issue of participants incurring debts or other misspending, we're going to do that at the beginning of their plans within that year. Okay.
That's correct.
Thank you. So,
perhaps, sorry, I hesitate to interrupt your flow.
I'm sure you've got
just to mention that the department did make a submission to the inquiry.
I haven't had a chance to read it. I've seen it pop up, but I haven't had a chance to read it.
It does have has a flow diagram at the end in an appendix, which might help you as well, just to sort of visualise it.
Yeah, I'll have a look at that. I think the thing I'm struggling to get my head around at this point is, like, if we just take the 390,000 with social and community participation supports, of that grouping, how many participants currently have plans longer than a year?
We'll have to take that on notice. That's the modelling we're doing at the moment, Senator.
Yeah. But do you have it, say, for participants overall? Can anybody give me just the baseline figure of all plans that currently exist? What year, what duration? Can anybody give me a plan breakdown by duration?
I won't speculate. We'll take it on notice and see if we can get something in the hearing. Okay. Otherwise, we'll take it on notice.
Because my concern is the vast majority of participants have plans longer than 12 months now. And so effectively what we're seeing here this evening is, regardless of how long your plan is, should the legislation pass, your plan is now at best a year before it comes up to renewal. Like that's, if 99% of folks have capacity building in their plan, that's 99% of plans that are going to have to be renewed before the 1st of October 2027, correct?
Senator, it's probably worth just clarifying the concept of renewal in this context. As you've stated, all participants will have their relevant supports reduced as their plan comes up for renewal or reassessment over that 12-month period. That will simply operate by force of law, i.e. the ministerial determination should the Parliament pass the law with this provision. So it'll be an automatic process, if you like, for which participants will clearly be notified.
Right. So when we say the plan will be renewed, it is simply that somebody will push a button. They won't have but the plan will start again. Like what? Sorry, I'm just. So I'm a participant with a 5-year plan, and so I've accepted a 5-year plan, and I've planned my life around a 5-year plan, and now my plan has to be renewed within a year. Is what is now required by the legislation, correct?
there will be an automatic renewal, if you like, at that point. That will have the one change, which is via the ministerial determination, as the minister intends it, which is to the budget for SCCP and community.
So that won't change any other aspect of their plan?
That's the intention.
That's right.
Automatic.
For that automatic piece?
It just changes that component.
Yeah.
Yeah. But if you cut 50% of a line item of a participant's budget, then it is very likely you will precipitate a need for an entire plan review, because the entire plan was calibrated around the funding that they had that's now been cut in half.
So the process of the agency determining reasonable and necessary supports through the planning process won't be altered by virtue of the ministerial determination. The ministerial determination will be an overlay, if you like, to the agency's support assessment.
Okay. Gosh, no wonder you're working it through. The administrative impact of that many people coming to you for requesting reassessment. Anyway, Allied Health Professionals Australia raised in their submission to the Joint Standing Committee in relation to scheme integrity. They raised in their submission, and they stated in their evidence on the 21st of May, that the planned 10% cut to capacity building funding will have downstream effects on other supports. For example, OT hours are crucial for getting properly fitted for a wheelchair, and cutting those hours could have could result in serious injuries from poorly fitting assistive technology. That was their evidence to us. How will these support determinations take into consideration these kinds of downstream effects?
It's Erin Rule speaking. Firstly, I'd like to acknowledge the submissions that have been received, and we're still working through them and analysing them. And one of the things that we do need to do is advise the Minister on the safety considerations when making the determination. So I expect that there'll be information in those submissions that we can draw upon, such as the one that you've just referred to.
But there's nothing in the legislation that is a permanent safeguard to ensure those types of considerations?
There is in the legislation a requirement for the Minister to consider safety when making the determination.
But only to consider it, not to have to act in line in it. You can just kind of think about it and then make the decision.
Senator, we can look at the precise wording. I can't quite recall it, but I suspect that a court interpreting that would require a consideration to be meaningful.
I think, Senator Steele-Drong, we talked before coming here as a group about how to approach the fact that this bill is actually presently before another committee inquiry, and our general posture, as I hope has been evident over the course of the day, has been to try and answer around policy intent as thoroughly as we can. I think if we're at a point where we're asking about submissions to the other inquiry or particular provisions in the legislation, we might be getting into a level of depth. I, for example, would have bought all of my bill materials had I known we were going to do that kind of examination today. So if we can try and stick around policy intent, I apologise, because we have attempted to be as forthcoming as we can be, but we're probably getting into a level of detail that's beyond what we imagined for estimates.
Look, I hear that and understand it. Yep. I wasn't asking for a comment on the nature of the submission. I totally understand that's for next week. Yeah, it was more that the policy intent in relation to the downflow of effects.
Understood.
Could I just make... Sorry.
No, you get...
I just wanted to make a point about CBDA, which is in the impact analysis. Obviously, the reduction that's being envisaged here is 10%. The other thing that is in the impact analysis is the average utilisation of CBDA is actually 61% across all participants. And that's quite... Obviously, there will be some people who have 100% utilisation of their CBDA, but for those people who have utilisation 90% or below, there is not actually a change in their capacity to purchase CBDA supports.
You make a good point, Mr. Connolly. Would you be able to take on notice so that we can understand as a committee the state of play in a little bit more detail? Could you bring us provide us with a breakdown of, or could whoever is required to do it, provide us with a breakdown of that utilisation rate by cohort of participant, so we can understand beyond the averages which you've quoted there, what it actually looks like for different cohorts of participant within the scheme. And then if that breakdown could further touch on state and territory differences, that would be appreciated.
We'll take on notice how much detail we can provide, and maybe we might also bear in mind that with the inquiry next week.
Yeah, I think it can do that. I remember years ago we got into a conversation about utilisation rates, and takes a bit of time to pull them out, but you do have quite good data on, or did have quite good data on utilisation rate by different cohort of participants. I can see Mr. Norton nodding. So, do you think that's possible?
We'll take that on notice. I know the actuary has produced that data set previously,
yes,
right?
It's the actuary that did it years ago. Yes, all right. Thank you very much.
And Senator Steele, John, will rotate when you've wrapped up this piece.
Yes, I'm at the end of that particular line of questioning.
Fantastic. Over to Senator Askew.
Okay. I'm just going to finish off Thriving Kids, and that will be the end of my questions for the evening. Thank you.
Thank you. It's Erin Law speaking. Perhaps while Ms Pajinski's coming to the table, I have found the breakdown of the plan managers and support coordination funding.
Are you able to table that? It might be the easiest. Is it in a format that can be tabled?
I'm not sure if it is in the format that I can do that, no.
Oh, okay, I can write it down otherwise. It's all good.
Or I can take it on notice and we can just provide it that way. Just to let you know, we do have the breakdown.
That'd be great. But yeah, if you could, that'd be great. Thank you. Okay, back to Thriving Kids. So this is more now around the workforce, I suppose. Just wondering if the departments map the allied health workforce and provider infrastructure currently delivering the early intervention services to children and families. So in your considerations?
So we are aware that at the moment there is already a very highly skilled workforce that does support children in early childhood, including the allied health workforce. We are going to be doing, as part of the workforce measures that are funded through the Commonwealth's investment, we will be doing early scoping work so that we can upskill the relevant workforces, including allied health and people in the disability sector and early childhood as well. So part of that will also have a modelling component to understand what the current resources are that the workforce has to support and upskill.
So that work hasn't been done already in regard to the likely impact?
I might have to take that one on notice.
Yeah. I was going to say, if you could, it'd be good to know what has been done and what mapping could be provided. These reforms will rely on an existing workforce, as you say, that's already under pressure in many parts of Australia, especially in the regional, rural, remote and out of metropolitan communities, where provider choice is limited and recruitment is difficult. Has the department modelled the workforce supervision training and small business impacts of transitioning children from the NDIS-funded early intervention into those Thriving Kids or foundational support? So similar question, but not the same with the regions?
I might have to take that one on notice as well, Senator, but I will just note that across government there are a number of initiatives for the care and economy workforce. For example, the National Allied Health Workforce Strategy, which is Australia's first coordinated national plan to strengthen and sustain the allied health workforce, which includes over 300,000 professionals across disciplines like physiotherapy, speech pathology and occupational therapy. There's also human ability and the National Digital Health Capability Action Plan that also supports the workforce.
The other thing we probably, and I'm not saying we've modelled this precisely, but the philosophy of a lot of the delivery on the Thriving Kids is to move to more group settings and natural settings, which in effect is more efficient in terms of workers than a much more one-on-one model, which is tend to be driven by the way plans are utilised in the NDIS. So we do actually think, not just in cities but also in rural and regional areas, that may have a benefit in increasing the effective labour supply for these services.
I'll keep going with these questions, but I have got some more concerns about that from a different aspect in regard to small business, but I'll come back to that in a sec. So has the department assessed the risk of clinicians leaving paediatric disability and early intervention work if provider revenue becomes unstable during transition?
Has the department modelled that?
Yeah,
I'll have to take that one on notice.
Okay.
Sorry, Senator, again, I don't... This is an area where, as you're alluding to in your other questions, if anything, we worry about workforce constraints. So I don't think we would put very high on the risk register the fact that people in this area are going to feel that they can't generate adequate income or demand, either inside the NDIS or through Thriving Kids, or in fact actually more broadly in the community, given how strong the demand for these things are. I think if we think about workforce shortages around the country, this is one that we worry much more about that than kind of viability.
Yeah. So I suppose providers are concerned that commissioning and procurement decisions may be made in ways that don't actually reflect the local service realities, so especially in those thin or geographical areas, which is, and the dispersed markets. So small and medium allied health providers, will they be able to contract directly under Thriving Kids, or will it fund primarily through like intermediary organisations? And I know that's probably part of the consulting that's going on, but how will that be structured? Will they be individually?
So at this point, in this stage of implementation planning across each jurisdiction, there are various approaches being taken. They're also at various stages in terms of their pre-commissioning activities and also their commission activities. And so at this point, it's probably information that would be better directed to each jurisdiction as to what approach they're going to be taking with commissioning.
But you would want to have some sort of oversight at a Commonwealth level, you would imagine, to make sure that the service delivery is available, especially in those thin markets?
We do, and as part of the implementation plans and the implementation reporting, that will be a feature of Thriving Kids for the next 5 years. Jurisdictions are required to specify which services and supports and what strategies they are also implementing so that there are services in regional, rural and remote communities.
Senator, it might be vital to be worth adding that one of the items that the Commonwealth is funding is for national workforce development and training, including dedicated funding for First Nations workforce and a child development micro-credential course for teachers in preschool to year 3, and a few other specific training programs that's obviously designed to increase workforce capacity as well as capability, and that will assist particularly in thin markets.
So in the during the period of transition, children and families may face delays or disrupted therapy relationships, and perhaps even reduced optional for their providers of choice. You've mentioned before the milestones that are going to be built into the agreements with the states and territories. How will they be monitored, and how regularly will feedback be provided and made available publicly?
So a few parts to that question. So part of the one of the benefits of the model of Thriving Kids is that it is going to be based on, in some circumstances, existing services in states and territories that will be scaled up and expanded, so that where a family is already connected to a particular child development service or maternal and child health care centre, that should be able to continue depending on the approach that jurisdictions take, of course, but that's one of the bases of this model, and with jurisdictions having such a strong role in service delivery. In relation to the milestones, so they're outlined in the bilateral agreement that's available on the Federal Financial Relations site. There's an attachment in that document that dictates each milestone. And so, for example, there are 4 this year that the jurisdictions need to satisfy before the first payment is made. And then there are 6 monthly implementation reports, and then that turns to annual implementation reports once Thriving Kids is fully rolled out. There will also be an annual report that is made public so that the community can see some of the outcomes and more information about the rollout of Thriving Kids, noting as well that there's information on the website at the moment, and that the Commonwealth does also plan to develop a national roadmap in the coming months to provide an overview of the services and supports that will be available.
So with the children still being able to have access to the existing services, or hopefully to the existing providers, will there be any, the costings for that will just be transferred between the state from the NDIA doing reimbursements to the Thriving Kids? How will the payments be structured for the two?
So the NDIA doesn't have a role.
NDIS.
No, that's okay. NDIA, NDIS.
No, not now. The ones that are there now, though, that when they are transitioned across, how would that be?
So there, I'll just break that down a little bit, because there is no plan, as I think Secretary Connolly outlined previously. There won't be a transition of children from the NDIS into Thriving Kids. So just wanted to kind of make that clear. There may be children who are exited through the usual course of eligibility reassessments, for example, who may access some form of Thriving Kids. Just taking you back to my answer previously to say that Thriving Kids isn't just about targeted therapeutic supports. There'll also be information and advice available for parents, and there'll be other services available as well. For example, the 1-800 Thriving Kids phone line that people can access. So it's not going to be a case of NDIS into Thriving Kids, although people who do exit the NDIS, or parents and their families, may access some of the general Thriving Kids supports. Does that answer your question adequately, Senator?
It does. It's just the, make it just sure that from a perspective of providers as well, if they're providing the same supports to the children, that they're still getting reimbursed in the correct manner that way. That was the main thing. Yeah.
So that will be a matter for the approach that states and territories take in commissioning services.
Okay, I've just got a couple that I was going to revisit in regard to the workforce. So noting that this is just the allied health sector is predominantly female, what industry transition or adjustment support framework has been developed to assist allied health professionals and small business owners, many of whom are women, who may experience significant adverse impacts if private providers are not engaged under the Thriving Kids model?
I suggest to the Senator that might be outside the scope of the Thriving Kids program. And refer to the, for example, the National Allied Health Workforce Strategy, and quite likely other reforms or strategies underway across government in the context of the care and support economy. As Ms Wood mentioned, the Commonwealth commitment does have about $60 million to support the workforce for Thriving Kids.
I think it's also just, again, come back to the context here, which is the NDIS itself continues to grow across the forward estimates, and we're rolling out for the first time in the first instance $4 billion of foundational supports, and there's another $6 billion that's still to be decided on the foundational supports when they're going. So the context here is significant additional injection of funds into this area.
Along with, whilst it's outside the scope of this portfolio, significant injections of funds into the veteran system to increase the pricing for allied health in the veterans area, for example.
And continued uplift in aged care as well. So, again, I come back to the point that if we worry on any side of this supply-demand balance equation, we worry on the supply, not on whether people will be adequately rewarded. And I can understand there may be some businesses who have not seen the detail of what is being done, or professionals who may be concerned about a transition, or they might be concerned about missing out on a tender process. So I understand that. Yeah. But it is in the context of expanding government funding in this area.
So with just on that, the procurement models, how are they being rolled out? And how?
So it's a state and territory matter to do that actual procurement.
Yeah.
And that's partly, in fact, this is why partly this Commonwealth and States agreed to this model. You made comments previously about thin markets, etc. Yeah. I think it's genuinely the case the states and territories are closer to those thin markets in most instances and have a greater understanding of the particular characteristics of their sub-regions and areas that they have challenges, which they've been providing many other services for a long time.
There's quite a few that are still struggling to get them. Okay, I think I'll leave it there. I think most of these relate more to the workforce, which may be better placed elsewhere, but I'll put on notice, so I'll leave it there. Thank you.
Thank you, Senator Askew. We'll now go to Senator Steele-John.
Thank you very much, Chair. Mr. Head, I've just had a chance to read through the statement, the communication that you tabled for us earlier today. I believe the Chair may have asked you also to see if you could provide us with a copy of a document that is linked in your email, the talking points securing the... yes, have you managed to find that for us in the intervening hours?
Yes, and I think I've indicated that it can be provided.
Excellent. Has it then been provided?
I don't know the answer to that yet, Senator.
I think it looks like it has been. We'll just wait.
It really just amplifies slightly the points that are in the note. But
yes, thank you. I just want to also check with you. So this is the email that you were referring to earlier when we were talking about social and community participation changes.
Yes, I think I indicated that I communicated the day after Minister Butler's speech, because we knew there would be interest, and much of that would be shared with our planners and people in the National Contact Centre. Yeah. And we have a good program of regular communication with staff around changes.
Okay. And can I just check the piece you were referring to earlier, when you were saying that you'd made clear that the changes wouldn't take effect until the legislation had passed. That section within this communication is primarily the paragraph. It is important to note that the changes announced by the Minister will not take effect until new legislation is introduced. Participants will get clear and timely information before anything impacts them directly. In the meantime, current NDIS eligibility and planning processes remain in place. That's the key part you were referring to.
And parallel communications go to people in senior executive and management roles to reinforce those messages in their team meetings. And I think Mr. McNaughton probably talk about this better than I, but I think also there's probably some adjustment to scripts that are used in the contact centre.
Yeah, okay. All right, thank you. Look, on a first look at it, I think I might have been able to identify some of what may have resulted in the miscommunication, and that is that while you do make it clear that that is the case, your clarity around that comes at the kind of bottom part of the communication, whereas the top of this that you've sent to people is a link to the Minister's speech and the transcript of the speech in which he speaks about social and community participation changes as the government intends to make them. So can I ask you to my office will endeavour to provide you with tangible examples of the dynamics we were describing earlier today, but I also wouldn't be surprised if you've had this feedback through similar DRO frameworks, so that the participants are coming to the agency confused about what the current state of play is. Can I ask you to engage with your complaints team and provide to the committee any data that you have about complaints relating to communication around social and community participation?
Very happy to do that. And I should say this is a general point rather than a point in relation to this specific communication, but as part of the work that Mr. Verlin talked about earlier, we are doing more direct communication with participants around changes in the scheme, and I'm looking at how we can do that in a somewhat more timely way than the systems have allowed us to do that in the past.
Okay, thank you. Now, let's go to the functional assessment tool. Have you started the procurement process for the functional assessment tool?
For the
functional assessment tool.
No. Well, actually, sorry. We'll just double check on it because we haven't actually appointed the technical advisory group yet. And right. So the technical advisory group is a key input to determining how the functional capacity should be determined. So I'll let Ms. Rule continue, but there's a sort of sequence to this that's important.
Yes.
Yes. Erin Rule speaking. And just to check, are you referring to the substantially reduced functional capacity test, or are you referring to the tool that's used, the support needs assessment tool?
The first one.
Yeah.
I trained my brain to not mix the two up. It's taken a while, but no, I'm referring to the what is colloquially referred to as the functional assessment, functional capacity assessment tool. But it sounds like it has a different technical name. Is that?
It does not have a name. We need to go through a process with the technical advisory group
yeah, okay.
to identify a tool, or if there's more than one, and that process still needs to occur.
Okay. So you haven't started the procurement process because you can't yet. So you've started. Have you started to design the tool?
Sorry, Talia.
No, we have not. We need to. It may be that the tool already exists, I should say.
Yes.
So.
Okay. I think what I'm hearing is technical advisory group comes first. So I'll go now to the technical advisory group question. Then might come back to the tool. What will be the role of the new technical advisory group?
Senator, I can describe that at high level. It's broadly with $3.3 million allocated in the budget to establish a group to provide expertise on the design of functional capacity assessment tools and instruments. So that's their general remit.
I'm sorry, it might be that your microphone's a little... Could you say that again? I didn't quite...
Sure, sorry. Yeah. Mary Wood speaking. There was $3.3 million allocated in the budget to establish a technical advisory group. Its basic role is to provide expertise on the design of functional capacity assessment tools and instruments, which is why we won't be doing so until that advice has been given.
Okay, thank you. So they will be... they will, for example, be involved in the determination of the details of the new permanence test?
They will give advice on how substantially reduced functional capacity can best be measured, and as Ms. Rule indicated, there might be different measures or different tools for different cohorts, and then the ultimate product, if you like, that gives effect to that through the legislative framework is Category A rule, which, as you know, Senator, will require agreement of the state and territory ministers once it's proposed by the Commonwealth.
Yes. Sorry. I think what Ms. Wood was trying to make clear was just to use the term determined, which makes it sound like it's a decision-making body, whereas an advisory body, in the first instance to the Commonwealth, and then would engage with the states and territories to determine what the rule is that gives effect with the incorporation of the advice. But it ultimately leads to government to decide what is the right tool and what are the right thresholds.
Or in this instance, it's governments in this.
Governments, yes.
From what you've described.
Yes.
So it's the advice first comes from the group to the Commonwealth, and then once it's consulted with the Commonwealth, then goes to the state.
Yes, I mean, what I would say, and I have to be careful not to preempt the Minister here, but certainly our intention is this would not be, that the states would have visibility of this technical advisory group, and so it wouldn't be sort of technical advisory group and Commonwealth behind closed doors developing things. The states and territories would be engaged on the way through so that they could then have that understanding as they are considering the rule-making process with the Commonwealth.
Okay, and that goes to my next question, which is kind of who will be on it?
Well, I'm definitely not going to preempt the Minister and provide that list. But the intention is people with genuine expertise,
right?
But also some recognition of the need for lived experience on that group. But it's expertise and lived experience was the main thing.
And I think, Senator Steele-John, we would recognise that that group will need input from lived experience, not just by way of membership, but also by way of deep consultation with people with expertise, including expertise drawn from lived experience, and that will be, my confident expectation is that that will be a feature of the tasking from government to the technical advisory group.
Okay, so is it correct to say that appointments to the technical advisory group will be appointments made by the Minister? Is that functionally, structurally how it works?
Yes, I expect so.
Okay.
I mean, there may be some other process involved, but essentially, yes. Upon advice from the department.
Yep.
And can I clarify, Minister, because there's a slightly different structure in this portfolio space than usual. When we say the Minister in this case, are we referring to yourself or to Minister Butler, or a combination of both of you?
We are both involved, of course, in the work, but in the specific question you asked, I expect it will be Mr. Butler that makes the appointment.
Right. Okay. And you obviously haven't announced the membership of the advisory group at this time. Have you published is there a formal mandate or description of the
terms of
reference?
Has not been published.
Has not been published. When do you intend to publish the terms of reference for the group?
Well, it's obviously ultimately a matter for the Minister, but I would envisage that the time the group was announced, the membership, that the terms of reference would probably be announced at the same time.
Okay. And is there you spoke in broad terms, Minister, about the types of people and expertise you'd be looking for. Is there a formal selection criteria for membership of the Technical Advisory Group at this time?
We're relying on the department for advice about the nature of the expertise that we would require. I'm happy for Ms. Rule to sort of speak about some of the considerations.
Yes. Have you put together a criteria for membership?
In short, we've conducted a process through a desktop review and also discussing requirements with key stakeholders, as well as the department's Chief Disability Advisor. You would understand that we've had many representations as well, but what we're considering is the breadth of impairments and expertise across demographics and the like, that those are the key considerations. It is intended to be a technical group, so and as well as Mr. Conley referenced, seeking people with disability to be part of that technical advice.
Okay, and which, you mentioned stakeholder groups there, which stakeholder groups have you consulted with?
Sorry, I haven't got that list. It's primarily been through direct representations or existing relationships in the department. As you know, we're in a large department, and there are other chief positions in the department, such as Chief Allied allied health officer and
So
the like.
you're referring to internal stakeholders?
Not
there.
only internal, but that's just an example that we've had external representations as well, but I don't have a list.
Can you take on notice for us which external stakeholders have been consulted?
Just to clarify that we haven't done a consultation process, but we've had representations from people, and so we have been engaging as people have been reaching out to us. But I just want to emphasise that that's not a deciding factor, but that is part of.
Groups have reached out to you.
They have reached out to us.
And do you now? So after that process, do you now have a selection criteria that you've been able to provide us advice?
As I indicated, the selection criteria is technical expertise.
Yes, but do you have like a framework that details the type of technical expertise you're talking about there to help guide decision making?
Senator, it's Mary Wood speaking. There's within that framework of technical expertise, there's obviously a range of disciplines that we're aware of that the Minister might want to consider that will
Which
assist.
of those disciplines?
I don't have it in front of me, but we're happy to provide that information to you.
If you could, we'll probably be here for a bit longer, so if you're able to get it this evening, that would be appreciated. There's no trap, if you like, here. I'm just trying to understand precisely what the criteria are for the group that you will then, for the advice that you will then provide to the Minister in this very important determination. So if you can give us the list of the types of expertise that you've pulled together, that would be very good.
We've certainly got a list of fields that we're happy to talk to. I wouldn't describe them as selection criteria in a formal sense, but
okay. How will the disability community be consulted on the work of the technical advisory group and the thresholds for functional capacity?
It's Erin Rule speaking. There's a range of processes we're considering. There will be a formal public communication consultation process that commences in October and runs until the beginning. Commences in August and runs until October. And then we are also considering existing stakeholder reference groups that the department has and the agency, and as well as working with the ministers on how we can facilitate a range of different appropriate formats of consultation keeping in mind, I think it would be a similar model to potentially to the Thriving Kids Advisory Group, where there's flexibility to talk to a range of experts or stakeholder groups as we develop the products from the technical advisory group.
The other thing I'd say, Senator, is I would envisage that one of the first agenda items of the first meeting of the advisory group would be formulating a consultation plan that the members of the advisory group were comfortable with, so they had the right input from the disability community. So whilst we have in mind a range of processes to make sure there's maximum involvement, I think it would also be one of those things the advisory group would turn its mind to, and if not the first meeting, then I would have thought very soon after that. And I understand the other thing that we would be advising the advisory group is the engagement we've had with disability stakeholders since the Press Club speech this year in particular was the very strong desire to have a clear understanding of the consultation roadmap. So I think our encouragement to the advisory group would be to make that publicly known as soon as possible.
Okay. Thank you for that. Could I take you now to plan suspension?
Senator, sorry. Just in case you wanted the information
yes, please.
Now on the various fields of expertise.
Yeah, let's do that. That's great.
Thank you, Senator. Sarah Hawke speaking. So the types of essential expertise that has been identified for the technical advisory group are First Nations diversity assessment, neurodevelopment and/or autism, allied health, preferably occupational therapy and functional needs assessment, paediatric / child development, psychosocial disability / mental health, disability and rehabilitation medicine with expertise in degenerative conditions, assessment, design and statistical expertise, lived experience expertise and administrative law. Other areas of expertise that were identified as being beneficial include general practitioners, primary care nurses, midwives, best practice child development, and expertise sourced from other statutory compensation schemes.
Okay, thank you. I noticed that there's not a reference to chronic illness in that criteria there.
So there's allied health, which would cover chronic illness as well as disability and rehabilitation medicine with expertise in including with expertise in degenerative conditions.
As well as general practice, which deal a lot with chronic conditions.
Yes, so that, I mean, a lot of... Thank you for that. Would you be able to... is that a document that you can table for us? What you've just read out there?
I don't think we can table it because I suspect it's embedded in the advice to the Minister, but we could, if you like, Senator, obviously it will be in the Hansard, but I'm happy to offer on behalf of the department to extract that information and have it made available to you.
If you could, that'd be great. Thank you. Thank you very much, Ms. Hawke, that's useful. On plan suspension, the bill allows for plans to be suspended if a person is not contactable, but the bill itself does not define what non-contactable actually means. So how will it be defined in the implementation of this power?
Sarah Hawke speaking. So the bill explains the reasonable attempts have been made to contact participants for the purposes of making requests for information under Section 36 or Section 50 for information or reports, and so the concept there is reasonable attempts.
So, Senator, the reason I asked Mr McNaughton to come to the table is I heard him talk about this before, and this part of the bill was really an attempt to deal with a quite practical, a very practical administrative practice issue that we face at the moment, and so I think that's why I think Mr McNaughton might provide a good bit of colour on this issue.
Yeah, thank you, Secretary Scott McNaughton. We'll continue to work with the department on what it looks like as part of this legislation reform, of course, Senator. But under the current state, we have an unable to contact guideline that we follow. It's usually about making between 3 and 5 attempts to contact the participant, 3 or 5 different mediums over a 2-week or 3-week period. And quite often we're able to, it's just convenience time, multi-channel, phone, email, letters. If we're unable to still contact that person, sometimes, very small proportion of participants, it's where it may be an issue and there's a deliberate unable to contact. There could be cultural issues, sensitive issues, person may be incarcerated. So we've got to go through a whole range of strategies around why the person may be unable to contact, but we have quite a mature process for unable to contact. As I said, we'll work with the department about how we would then apply that as part of this new suspension process. So we'll continue to work that through, probably building on what we do today.
Okay, thank you, Ms McNaughton. So that's what we currently do now. But my question was, since the bill doesn't define what non-contactable is, how will it be defined as part of the implementation of the legislation? So that was my question.
Well, sorry, I mean, and Ms Hawke may want to comment, but I mean, the legislation at stand is the CEO is satisfied that have made reasonable attempts. So ultimately, it would be in the first instance Mr Head's forming the guidance of what reasonable actions are, and then presumably if someone ultimately wanted to appeal that, then they would have their usual appeal rights if people thought that was not in fact reasonable.
That's right, and I think what Mr McNaughton's outlined is really how we would intend in the new world to enliven the process that's been evolved over time and with a lot of experience in the scheme to date.
Okay, so you're, just so that I understand it, Mr McNaughton's talked about 3 to 5 contact attempts, which can they be phone calls and other versions of attempted contact? So
we try multimodal, Senator, in case, you know, text is a preferred contact method, emails, letters.
Yeah. So what you're saying, just so I don't misunderstand you, is that 3 to 5 forms of contact, and then the plan would be suspended. That could be the determination under the legislation.
We would have as Mr McNaughton's outlined, an operational protocol around this.
Okay. So if a plan is suspended for 90 days, the person's access to the scheme is then revoked. That's another part of the legislation. How will discretion be granted for people who are in hospital, who are overseas, or are not contactable for legitimate reasons out of their control?
So if I'm reading the legislation, and this is very dangerous, me doing statutory interpretation on the run, but in 40A subparagraph number 8, it's essentially a paragraph that says if the 90-day period has come up, the CEO would still have the discretion to take the actions which are in paragraph 4, which is to actually cease the suspension of the plan.
Yes. So
I would just say, if we are getting into that level of, you know, a line and verse of the legislation, I think that's really the part for next week. The policy intent, absolutely today.
Yeah.
Just that sort of
I hear you, Chair. I had drafted these questions with the intent of understanding the intent.
Before you get to next week, yes.
Oh, no, understanding the policy intent, as is the purpose of estimates, and then we can go into the further mechanical detail. So maybe I'll just do a bit of verbal reframing. So in terms of the policy intent of what we're talking about this evening, what is your department, your government's policy intent of how to tackle a situation where somebody is non-contactable for legitimate reasons for a period of greater than 90 days?
I wouldn't normally jump in on the policy intent, Senator, but I think what these provisions do really is provide a more formal framework for dealing with something that can be challenging operationally, but there are a lot of checks and balances in there in terms of providing the CEO with discretion to overturn decisions. So it, in a sense, regularises and authorises a world in which an operating protocol of the type Mr McNaughton articulated can work well, and where the CEO is able to exercise discretion in circumstances where of the type that you outlined.
Okay, thank you for that. So again, staying at the level of intent, if somebody's access to the scheme is then unfairly revoked using this power, will they have recourse to challenge the decision, or would they need to reapply?
It's a reviewable decision, Senator.
Okay, thank you. So they would be able to seek a review. Now, my office has heard countless examples of NDIS participants, basically people talking to us as participants who've talked to us about the failure of the agency to meet their communication needs. Particularly, and I'll give you an example. I've spoken to a person who is low vision and who has said that the agency continues to send her documents in formats that can't be read by a screen reader, despite her communicating that she is unable to access them. I wish that this was the first of that specific type of failure that I'd ever encountered, but in 9 years I can tell you that it isn't. I've lost count of the number of times where that has been brought to me. If someone is deemed uncontactable because the agency repeatedly fails to communicate with them in an accessible way, will they then have their plan suspended?
Sarah Hawke speaking again. The policy intent is to enable the CEO full discretion in relation to the application of that suspension, notwithstanding the period of 90 days.
So you could, using that power, Mr. Head, craft is it your intent to craft a discretionary policy that would take account of situations like that?
Normally, I think, provided it's not inconsistent with the legislation, I think for these sorts of things, particularly where things might go wrong in people's lives, or something happens that disrupts the communication, you would usually have a protocol where there's a set of sort of heads of consideration for how you make the decision, so that we're not putting people through onerous processes because of a miscommunication.
Yeah, okay. Because what concerns me is that this participant's recourse would be that they would have to seek a review of this as a reviewable decision, which they would have the right to do, but that's quite an onerous process to go through if it's been the agency's failure that's led them to reach into the 90-day period.
And indeed, Senator Steele-John, I think the insertion of the word reasonable into the legislation is an indication of the intention.
Thank you. Okay.
It needs to be reasonable.
It needs to be reasonable. Now, just moving back to the simulated, the needs assessment simulations that we were discussing earlier, I just had a point of clarification there.
And Senator, while Mr Verling comes to the table, I took a question on notice to confirm that all 81 of those support needs assessors are allied health qualified.
All 81 are?
All 81.
Fantastic. Would you be able to provide us, it would be on notice at this point, their allied health backgrounds?
If I have that level of detail, I will provide that on notice.
Thank you very much. Could I just clarify, you were describing the process and the experience for participants. You talked about receiving a lot of feedback from participants that this had been a positive experience. They had found the conversations to be useful for them. What is the pathway for a participant to engage in these simulations if they are non-verbal?
So the support needs assessment conduct will be conducted in any communication mode appropriate for a person with disability. The ICANN has been used for many years across a number of modes. And so as part of the testing phase, when we then start to bring in additional cohorts for that testing, we will work through those processes. But we've been really clear that it has to be applied in the most appropriate communication form for the participant.
Okay. Have you had, so far you've had 290 of these simulations. Have any of them included people that are non-verbal?
Not at this stage. Some of the early testing was for cohorts that we were starting to think about for the first transition. Now that we are delaying the commencement until April, gives us an opportunity to think about which cohorts will transition first to ensure we do appropriate testing and validation of those prior to commencement.
Okay, thank you. Would you be able to tell us if you've got a target or any other kind of policy in place around the number of non-verbal participants you want to include in your simulations?
We haven't got a specific target for particular cohorts. However, it is appropriate as part of our briefings within the agency and certainly with the department and ministers about providing an appropriate validation and testing program for all cohorts.
Okay, thank you.
If I can add, Senator,
yes, please.
Strong oversight of the development of this process. I chair the steering committee with Melbourne University and the Centre for Disability Studies, which has some of the leads in the consortium with senior staff from the agency. So the focus on ensuring that the extra time available delivers very significant additional work in the validation space and the design space is, really being, I guess, ramped up.
Fantastic. I also, when I asked about the supports needs assessment during, I think it might have been the last estimate session, actually, it's going back a way, I was told that there were additional modules that were being developed for areas that aren't covered by the ICANN tool in its natural form, and it's covered by the tool. I was told that there would be modules for disability health-related supports, for assistive technology, home modifications and behavioural supports. Have these modules been developed, and if so, what do they look like?
We have just completed our first draft of the targeted modules. We've been working with the department about those. They will range depending on the particular module that you've observed, Senator. For example, some of the home modifications might be just defining a process on how to get a quote and how to get an assessment. We're building a fair bit on the existing arrangements that occur. However, now that they've been drafted, what we want to do is then start to bring that into the testing. So we go beyond the ICANN and start to do testing on the targeted modules in addition, which then brings additional cohorts into the testing to really work through what are the types of questions or what is the additional evidence that we may require in order to determine the appropriate supports.
Okay. So in terms of the process for reviewability, is it correct to say that the review process for these modules will be that they are gradually included into the broader simulations?
Correct.
Okay. First of all, can you just confirm for me the modules that are in existence?
Yes, so at this stage there's assistive technology, disability health-related supports, home environments, which is your home modifications and specialist disability accommodation, and behaviour support.
Okay. And practically and tangibly, are we talking about documents? Are we talking about videos? What does a module look like in this?
More likely documents, but again, we're just working through now that we've had a first draft of what those policies are. Yes. What we'll then do is really test about the form that they are in.
Okay. Are you able to table for us the first draft of those documents?
I need to check with the department.
Can we take that on notice?
Yes, can you, or take on notice whether you can provide the first draft of those documents? I understand they will be iterative and draft means it'll change, but it's useful for the committee to know what they look like now. Now, will there be is there any scope to add additional modules or any additional modules under consideration?
Certainly at this stage, it's what we've done is try to capture all of the supports that are currently. If there are gaps within the testing, that is also part of what the CEO has advised as part of the consortium, is really understanding as we move away from the core ICANN, and I think we've been really clear that the support needs assessment uses the ICANN as the basis. There may be requirements for further modifications as we start to transition more cohorts.
Okay, thank you. Now, the start date of new framework planning has been pushed back to April 2027. Is that still the intended start date? Yes. And I understand there will be further consultation on the rules that will underpin further network, the new framework planning process. The last consultation earlier this year went for about 6 weeks, and we had very little detail for stakeholders to evaluate. Will there be an exposure draft for this new period of consultation?
Erin Hall speaking. Yes. So we do have a consultation process planned between August and September this year. Right. We're thinking through what the best format is to do that in. I'm not saying no to exposure draft of the rules. The rules that may come later. The intent of the consultation is to provide simple, plain English in far more detail, but in simple, plain English, whereas the rules will be very legalistic. We would like to provide that, but I would suggest that's not the next step in consultation because it won't assist the community to understand them really. I think that the role for us in the next phase is to present detail that's been requested, but in a way that's plain English and that I can explain, that we don't need a lawyer to explain.
Okay. And then once that consultation takes place, how will the feedback be incorporated?
So the consultation, we're working through that at the moment to... part of it will be, as I said, information provision, and then the sorts of things that Ms Hawke and I are thinking about is how it probably does go to that communication element and transition element of how can we work with the community to ensure that we prepare them for the transition, what sort of information do they need. Mr Verlin has touched on this throughout the evening in terms of what he's been discovering through the testing. This is our opportunity to speak to the community about what is a significant transition and seek their feedback once they've seen more detail. How do we move to implementation?
Senator, if I can just add one thing. To me, this should be a fairly standard consultation process. We take feedback, we decide how much of that's going to be incorporated, but I'm a very strong believer across our whole portfolio that where we choose not to accept feedback, we should be as transparent as possible about the reasons why we've done that, so community members don't feel we provided this input, I've got no idea where it went. If there is a valid reason that we feel we can't take it up from a policy perspective, we should be explaining that back to members of the community stakeholders on the way through. And while I've got the floor and people are watching, I think there's about 280 in the country. That's a general thing I think people should expect of our department, that if we have reservations about their point of view, we should be on the spot to provide that feedback so people then have the opportunity to either clarify their position, which might change, or to go away and think I need a better argument to convince the department and ultimately the government. So I just want to put that on the record.
Thank you. Now, can I ask about the participant pathway reference group? For clarity, what is the role of this group?
So the participant pathway, we've got a participant reference group, and we've got a participant pathway co-design group. I'm just checking which group you're referring to, Senator.
It's the participant pathway reference group.
Right.
Sorry, can you give me those?
We have a participant reference group, and we have a participant pathway co-design group.
That one, the participant pathway co-design group.
Yep. And so the intention of the of our co-design program, and we've been running it for well over 12 months now, was an opportunity to have formed a group that comprised of DRs, our disability registered organisations. We had an IAC member, and we also had participants on that. That specific group, the participant pathway group, was the group that we utilised to design the first participant pathway for new framework planning. What would the participant journey be from end to end as part of new framework planning? And so we did a number of workshops with the group to really set out where we were going to see risks or challenges with the core pathway. And then what we did is we then broke down each one of the moments of that pathway. For example, preparing for a support needs assessment, undertaking the support needs assessment, having the plan discussion with a delegate, and then plan implementation. So taking each one of those moments and really unpacking that about what were the most important things at that moment for a participant, not from an agency perspective or from a delegate perspective, but what did we really need to be mindful on as doing our design as part of the pathway. So that's been the core intention of the group.
Okay, and they've existed for, did you say the last?
Well over 12 months.
12 months or so.
Yep.
And the first group you mentioned, the participant reference group.
Yep.
What is the role of that group? How do you differentiate between the two?
So the participant reference group is a group established by the agency. It's established by our participant advocate, and that is a group of about 25 participants. And the agency can use that for any change within the agency, and so that is a more formal, ongoing group that we can utilise for general agency updates. We can bring particular changes. It's our opportunity, essentially, to have a core group of participants and carers. I should say it's not just participants; it's also carers or parents. It's just an additional forum that doesn't have sector representatives or the IAC. It is straight participants.
Right. Okay. And how long has that group existed for?
That group has existed for a number of years, and the membership is rotated every 12 to 18 months with new participants to come on board.
And the participant pathway co-design group, the one that's existed for the past 12 months, how many times has that group met in that 12-month period?
Primarily, it had met monthly. There were times when it was paused when we were holding and seeking additional information from some of the other groups, but our aim initially was monthly. What we have recently done with the sector organisations last week and with the IAC is really have a think about how do we want to take these groups forward, particularly between now and April. What we want to do is maximise the opportunity. I think the Minister has been very clear in recent forums about where are the opportunities to do co-design and do co-design well versus consultation and just broad engagement. So what we want to do is really think about one or two moments in that pathway. As we spoke about was the design hub where we're bringing participant insights and changes. How do we maximise those opportunities? And so we are doing some thinking about reforming some of the groups as we move forward, particularly between now and April.
Okay. And the participant reference group, how many times have they met this year?
I'll take the rhythm on notice. I think it's 4 or 5 times a year that they meet. They meet in person for 2 days. It's a different structure, but I'm happy to take on notice the operating rhythm of the participant reference group.
Yeah, if you could, how many times they've met in 26? What were the dates of those meetings? And then how many times they met in 25 and the dates of those meetings?
Certainly.
Thank you. Now, if we could just return briefly to the intent of the bill that's before the Parliament at the moment. There's been a lot of conversation about parental responsibility and the changes in the legislation in relation to parental responsibility. Can you explain for us the changes to parental responsibility in the new definition of reasonable and necessary? And to clarify, what I'm looking for there is the intent of the changes. I understand we'll go deeper on the bill next week.
Speaking. Thank you, Senator. So, in effect, the codification of parental responsibility in the bill is in part an uplift of some of the criteria that is in the current support rules.
What do you mean by an uplift?
So it's codifying some of the changes around reasonable and necessary, codifying what's in the Act, what is already criteria in rules that need to be considered by delegates in determining, for example, what's effective and beneficial, what's value for money, and what considerations need to be taken into account in determining, in clarifying what is reasonable to expect in terms of the role of families, which is already a criteria and a requirement as part of the determination of reasonable and necessary supports in the Act. So it's really clarifying what a delegate needs to take into account in making those decisions.
Okay. And just so we're on the same page, that's the amendments proposed in to the current section 34(1).
Yes.
Yes. And the requirement that parents provide a substantial care and support is, I think, the proposed section 34(1)(g).
Mm-hmm.
Okay. Now, when I first looked at these changes, something jumped straight off the page for me personally, and that is that when within the legislation as defined at the moment, it talks about parental responsibility. There is no exception within the legislation around the parental responsibility that may be placed on a disabled parent. So I'm just seeking to understand that I haven't kind of misread or missed a piece of clarification. So is it correct that there's just one definition of parental responsibility? There isn't another clarification around what that might look like for a disabled parent in the Act?
Yes, thanks, Senator. Sarah Hawke speaking. So in relation to consideration of parental responsibility and the principles that are outlined in the legislation, that is really considering the supports for a child, and of course that would be necessary for a delegate to take into consideration that the child and that family's circumstances in making that assessment, but also relevantly in relation to a parent with a disability who may also be a participant, that would be relevant there would be relevant considerations in determining what support the parent participant needs in relation to their disability as well.
Okay. But I just want to clarify, there is no exception to applying parental responsibilities to adult participants within the NDIS Amendment Bill, is there?
No, that's correct.
That's correct. Okay.
Sorry. Sorry, Senator Steele-John. I think that we are now again in the territory of really going line by line through the application of the legislation, and we really have tried over the course of the day to speak broadly about the reform, the intents of the reforms, but I do think how the legislation would apply to particular people under particular circumstances starts to really get into the detail of the bill. And the Chair may assist, but I mean, as I understand it, the reason the Senate observes this rule is because when the Senate sends a bill to a particular place, the expectation is that the evidence in relation to the bill will largely be heard in that inquiry, not in other forums. So we are trying to assist, but we probably are coming up against the limits of what's reasonable.
Okay. And I've heard that from yourself. I've heard it from the Chair. I think I'm happy to try to draw myself back up to the intent level. I just, to be quite honest with you, as somebody who's not yet made the decision, and I'm happy to put this in a public forum like this, I've not yet made the decision as to whether I would like to become a parent at some point in my life. If I make that decision, what reasonable parental responsibility for me or for any disabled person looks like, it's very different to a person without support and access needs. And on a first read of your legislation, and what's been confirmed this evening is that nuance isn't reflected in the legislation. There isn't an exception there, and that is what I'm trying to get to is whether that's the intent of the legislation before the Parliament, or whether that's a bit of an oversight.
Well, again, the Minister's making the point really whether this is a kind of an inquiry into legislation where presumably other members of the Legislative Committee would like to hear that debate, or this is related to the estimates before us. I mean, this question here is partly well material, but with the indulgence of the Minister, I would say the intent here really is to say you can't, the default is not to outsource all the activities that you would normally expect it to be provided by a parent if you don't choose to do that. And I think Ms Hawke has really taken into account that an assessor would take account of the circumstances of the family when interpreting that clause. So without going line by line, that's the intent of that clause.
And could I also add, in relation to we were talking about the provisions specifically relating to children, but of course there are general principles in the Act already that it's necessary for and appropriate for a planner to consider for an adult participant other informal supports, including family, peers, clubs, employers and local services in the context of considering a planning and reasonable and necessary support. So I just wanted to make that point of clarification.
Yeah, I do understand that there's... What you're describing is the mechanisms by which discretion may or may not be utilised, individual circumstances may or may not be taken account of. That level of flexibility doesn't really give a lot of certainty for somebody, and there are many, many disabled people in this situation who are weighing up whether they would like to go down the road that is bringing a child or another child into the world in the context where that requires additional supports to take account of the fact that what parental responsibility looks like for a disabled parent is different than a non-disabled parent. A clear exception or exemption or an additional clarification or a different definition could have provided that certainty and clarity. It's not currently within the legislation. So I think in terms of the intent, Minister, it seems as though the intent of the government would be to provide that certainty and clarity. Is that correct?
I think we want, in this instance, the situation you're actually describing is about the needs of an adult with disability rather than a child. And we want adults with disability to have the support needs that they require. And that remains the goal of the NDIS. For the eligible adults on the NDIS who have significant and permanent disability, we want them to have
I'm really not far off.
The means to meet to have their support needs met. So
I understand that, Minister, but what we're dealing with here is a situation where somebody is simultaneously a participant, an adult participant, and also a parent. So that overlap, that is not, we're not actually talking about something wildly uncommon.
No,
many of my friends that are disabled folks have got kids. There is not an acknowledgement of that overlap in your legislation.
I think Ms Hawke has indicated to you that the assessment of what's possible in a family gives consideration to a range of different factors, and she ran through those with you before.
Yes, she did, and she talked about the factors that may be considered, and the observation that I've shared with you and will be shared and is being shared by disabled parents across the country is that a kind of commitment to think about it, to consider it potentially, is not a firm enough basis on which to plan a family, and that the legislation could be amended with a more nuanced definition, and that is what I'm hearing. But I feel like, for the purpose of progressing this evening, I feel like we've kind of gone as far as we can down this road, but the nuance is not there. And if it is the intent of the government to provide the nuance, then I think amendment to the legislation in this area is needed. In terms of okay, that. Give me 2 seconds, just so I don't waste our collective time with things that will now need to go to the hearing.
And I will just say we'll break in a few moments for our evening
break. Beautiful. Okay. Well then, very much at the intent level, the transitional powers within the bill. What is the intent for the transitional powers? Because they are broad. So I really can only ask you for intent on these. So what is the intent for the transitional powers?
Sarah Hawke speaking. They are quite common in a bill of this size. I think in the explanatory memorandum outlines that they are intended to deal with any unintended impacts from the amendments, and they will that transitional power only is available for 12 months, and and any rules made within that, I think I need to double check this, would sunset within that 12-month period. So it's a safeguarding provision in enabling the establishment and implementation of the reforms enabled by the bill.
If I can be as helpful as possible, this is essentially what is commonly referred to as a Henry VIII clause.
Yes, it is. Yeah.
And so the intent really is, as has been commented by Ms Hawke, that you may have an unintended consequence. In fact, in recent times, things that come up can be actually things like just does the IT system that you've built align with the way the law has been put together, for example. The idea is a time-limited window for 12 months, and then once you've made it, they're limited to 12 months. So the concept here is the government would have to come back to Parliament to get approval for any change in that law. It just means you don't have unintended consequence, and usually it is used by governments when not having that clause would actually disadvantage, say, in this case, participants in the scheme. That is the primary intention of that clause.
But just to clarify, you don't have to come back to the Parliament in 2 years' time, because you've got the power for 12 months, and then anything you make during that time then lasts for another 12 months.
It's Erin Rule speaking. So there's a period of 12 months in which the rules could be made.
Yes.
And then those rules would expire in a period
in
of 12
months' time.
Yeah.
So it could be a maximum. If you make all the rules in November, after
they lapse in
they
the next
lapse in
November.
12 months.
So it's when you make a particular rule, there's 12 months from that
period.
rule.
Yeah, so if you wait until the 11th month in your 12-month window and then make your rule, it'll be 12 months.
But then it wouldn't. Let's just be clear. You do this when you think there's a problem.
Oh.
And so you wouldn't, if you thought there was a problem and you identify it, you wouldn't wait until the November to exercise the rule. You fix it as soon as you can, because normally the circumstances you worry about is I can't make a payment in the way I'd like to a participant, for example. So as soon as you identify it, you probably trigger your desire to make the rule.
Yeah, I think I'm conscious of many reports delivered to the Senate by the Senate Scrutiny of Delegated Legislation Committee. The most recent, I think, in 2019, which raised serious concerns with the use of Henry VIII clauses. I've described them as potentially resulting in a subversion of parliamentary scrutiny, and recommended that they be limited to only the most extreme circumstances. That was quite a detailed inquiry, took a lot of evidence from academics. I understand your position, Mr. Connolly. It's the position that is put by governments whenever they put forward these clauses. But it's then for the Senate's job to consider whether it's reasonable in this context. I think we'll go to the break at this point.
Yes, we will.
Thank you.
We will suspend and we will return at 9:45. Welcome back, everybody. We are now on the final stretch and we will go to questions from Senator Steele. John.
Thank you very much, Chair. Okay, is the agency currently recruiting support needs assessor roles for the second half of this year?
Hello, Senator Scott McNaughton. Yes, we are recruiting support needs assessors. Some of those will be internally recruited. We'll also go to market to recruit some external support needs assessors. We may also talk to some of our existing partners in the community to see if they had suitably qualified people who may also be support needs assessors into the future.
Thank you. I've seen an email from a recruiter that says, and I'll quote them, we are immediately recruiting multiple nationwide, we are immediately recruiting multiple nationwide, I think there's a typo here, but multiples nationwide, for a leading federal government agency with contracts running from July 2026 to December 2026. In this role, you'll work directly with participants to assess their support needs, and you'll help to ensure they receive the right services in a respectful and evidence-based way. Is this is the federal government reference there, the NDIA?
I would have to take that on notice, but we are in the market. I can only speculate that it is us, but I'll take that on notice and confirm it. We are in the market with recruitment firms to do that work.
Okay. And what are these roles for, considering that supports needs assessments aren't expected to begin until April next year, and these contracts will be completed by December?
Yes, so Senator, what obviously we need to do to get ready for the go live in April next year is to build a very capable workforce that we can do two or three things. One is to do the testing that Mr. Verleen talked about. As I said, we want to do somewhere in the vicinity of 5,000 to 10,000 simulation tests in the back half of this calendar year. We will then do more tests after the Christmas period, and then we'll start a pipeline of getting participants ready for go live in April. You need a fairly sizable workforce for the numbers. We're talking hundreds and hundreds of trained, accredited, skilled support needs assessors ready to go for April. So this is building our workforce. Of that group who we're recruiting for that period of time, we expect many of them will be offered on additional contracts, and we'll continue to work with recruitment providers to help us source staff for that too.
Okay. Just to help me understand though, given your goal of building that workforce capacity, why such a short contract?
Senator, is largely due to some contractual issues that we have with the recruitment providers that we're working with at the moment. We're hoping to quickly go back out to market in the near future off much longer contracts, potentially 2 years or beyond if we can.
It's intriguing. What are the contract issues you're referring to?
I might be out of my swim lane here shortly, Senator, so okay. I might take that on notice and come back to you around that, but we are having some limitations around what we could do with the current recruitment contracts that we had in the agency, and we need to go back to market to tender for recruitment providers.
Okay, if you could go on notice, come back to me with what those issues are, that would be really useful. Now, how is workload considered as a factor in determining NDIA staff funding? I'm not, when I was writing this question, I was not massively clear who it would go to, but it might go to you, Mr. Connolly, in terms of submissions that the department makes as part of the funding budget process, potentially.
Just repeat the question, sorry.
Well, so I'm wondering, when the work is done to determine the staff, the quantum of funding for staff at the agency, the number of FTE, how is workload considered as a factor in that determination?
Oh, well, look, this is very standard across the whole of government, Senator. agencies make a calculation of what they think is the required workload, with people working at what I describe as a reasonable intensity. That's what our obligations are as Mr. Head and I, as managers of the organisations. And then we put effectively a policy proposal into finance through the normal budget process, and finance will form a view, one, whether they think that's the right allocation of resources for the tasks. They'll also form a view often about whether we have the capacity within our agencies to reallocate resources to those tasks. In other words, find internal offsets. So, you know, we don't work on the assumption that people can just work around the clock. We work on what is a reasonable intensity, and then we have to negotiate with finance as to what's a reasonable allocation, and ultimately agreed by ERC.
Okay. And in that process, when it comes to the question of reasonable intensity, you said finance might have other views. Can you just step out for us how, actually the process finance might decide they
It depends on the type of task. So for some of the stuff that we do in the department, such as policy advising, that is legitimately quite a difficult thing to work out how many people you need for that. When I think about some things in the agency that look more like, routine or more routine processing things, they would, for example, think if you had new framework planning, and we had the evidence earlier from Mr. McNaughton about how many hours it takes to do a particular assessment, the agency would put together not just the hours in the interview, but the prep work, etc. We think we can, do X number of people in a day, and therefore, if we've got to get through 100,000, we work out how many staff are going to require to do that. So they are the sort of calculations, and therefore you would haggle with finance over, is that a reasonable allocation? And probably that'd go back to Mr. McNaughton, and I'm conscious this is a long answer, but they would probably then say to Mr. McNaughton, surely you'll get quicker as you go through the thing and you get more experience, and therefore I'm going to give you staff to do one a day for the first 3 months, and then I want you to cut that down to 2 per day as you get more experienced, or I'll consider how you automate. So that is a very kind of high-level description, but that's essentially what it's like.
Okay. Thank you for that. I'm the last person in the world that's going to critique a long answer. I've given you many a long question this evening. So when the modelling was done to determine, first of all, when was the modelling done to determine how many staff would be needed by the agency? So I think what you've just described, and never having been on this particular part of the governmental process, but what you've just described, I think, is you pull together a proposal for finance, you give it to finance, they say, we agree, we disagree, you haggle, you bargain, and then it goes to EAC, and then you get your outcome. When was the modelling done on agency staff level requirements that then fed into your first proposal?
First proposal for what?
To then go to finance.
It depends which proposal you're talking about. I mean, essentially, let me just step back a bit. Anything that appears as a budget measure or a MyEFO measure, this is not always the case, but generally speaking, if you had a budget measure, we would have been started working on that before Christmas, often. Maybe not in details, but start thinking about it. We'd have to say it's worth coming forward. We would at some point in that, either us or the agency, think preliminarily how many staff would be required, and then there would be quite a toing and froing process to try and refine that. Often it's not a linear process because what is the policy might be evolving through that process
through that period of time.
But I think the simplest way to understand it, Senator, is that it is part of the budget cycle. So it would happen before the budget, and should it be necessary, it may also be a exercise that occurs before MyEFO, should that be relevant.
Okay. You also said to me, Mr. Connolly, that you're required to consider, was it reasonable intensity? Is the word for...
Yeah, but that's across the whole public sector. We
there's a
need to maintain, reasonable work-life balance for our staff.
Reasonable work-life balance. So that's a consideration that the entire public service has. And to be able to ascertain that workload, current workload, expected workload, would be factored in to determine what that looks like?
Look, what we would do as an organisation is, yes, we'd do current workload. We do things also like track what's happening to unscheduled absences, which can be a proxy for intensity. We also look at things like our APS census results, and then one of the questions in the APS census is our staff will provide an answer to a question on, do you have significantly more work than you can deal with, a little more than you can deal with, is it about right or not enough? So I think, there's, in some areas, those are the metrics that matter. I think in some areas that look more like repeatable administrative practices, you would track metrics of productivity, and you would benchmark those where you can against similar activities to say whether that's reasonable. And
that benchmark and the process you're describing there, that kind of begins at around, would have begun this year around Christmas? Is that
so I suppose the thing I'd say, Senator Steele-John, is you can think about it for particular proposals. I would say we're doing this continuously. So we're either doing it as we reallocate resources within the organisation on a budget basis or on an internal basis. From time to time, agencies often end up doing functional and efficiency reviews or get external consultants in to say, is this reasonable? All of the above is done by most agencies at different points in time.
I'm getting a picture of that now. I think the bit that's not quite aligning with me is, while I absolutely accept you do it continuously, there's also a structure and tempo to the feed-in process to each federal budget. So while it's a continual thing you do, there must be a moment in time where you analyse workload to kind of feed that element into the maintenance of work-life balance you've also referred to. So just wondering when that occurred.
Look, again, it's a continuous process in the budget process. It really is. And so, and the thing that is part of it is we will think if it's a new function, what is the genuine additional resources? Sometimes actually what you're bidding for in a budget process is there's a terminating program which is not funded beyond that point in time. Most of us as agencies would make a case to finance that, well, if you want the same program to continue, I need roughly the same number of resources. There's also an overlay of an efficiency dividend that comes into the whole process. So.
Right. Okay. Yes.
So
you do all the work and then the efficiency dividend. Yeah. Okay. I'm getting a picture of what you're saying. Thank you. Does the 26-27 budget fund any additional staff for the agency to perform its new functions?
Well, it's in the budget papers.
I think it's in the...
So if I turn to outcome 4...
Yeah, that was one.
...of the budget papers I have to go to the NDIA. I was looking at the department's one. This will be a race at the table to see who can get there fastest.
There's a couple of packets of biscuits in it for you.
363.
I think Mr. Porter provided some advice earlier in the day about...
Who was that, sorry?
Mr. Porter. Sorry, I'm away from the microphone. I think Mr. Porter provided some advice earlier in the day about NDI staffing numbers, including some advice about the approach to just one or two issues where there's a finalisation of some matters required.
I might leave Mr. Porter to talk about, but I'm looking at page 367 of the portfolio budget statements, which has the average staffing levels for the NDIA, which has a small step down, but Mr. Porter would be closer to analysing what the kind of ons and offs that explain that change.
Sam Porter speaking. The budget and the budget measure includes 815.7 ASL for the implementation of new framework planning. 815 ASL for the implementation of new framework planning.
815 was that? Okay.
Correct.
Fabulous. So where is the decline in average staffing levels in the 26-27 budget coming from within the NDIA?
Senator Steele-John, we are currently working through our internal budget allocation process for next financial year. We're working through a process that will essentially result in reprioritisation of some staff across the agency with some clear criteria and prioritisation given first to staff safety matters, second to frontline delegates and maintaining frontline service levels, and so on and so forth. There's a range of other categorisations that follow from that. But the clear priority is to prioritise staff safety and frontline service delivery.
Okay. But just to be clear, you're not disputing the fact that at the end of that process there'll be, I think it's, is it 625 fewer staff at the agency?
The minimum ASL for next financial year is 9,840. I gave evidence this morning, just after we started, that that's the minimum level. There is a budget measure for the delivery of payment at point of support. The technology program that Mr. Dardo gave evidence about, that will include additional staff for the agency. I'm not in a position to tell you how many there are because it's going through the DTA approval process at the moment.
Okay. What is the performance outcome, the KPIs for planners, and how was it developed? Particularly, I'm interested in how it takes into account the variability and complexity of each individual participant.
Senator Scott McNaughton speaking. We have a range of performance metrics for staff. We developed that with a consultation with our staff working group and also our CPSU. And it also is depending on what specialist area of the business you're in, but for generalised planners, it's around 4.5. I think there's a range actually. I'll take on notice the actual range for you, but it's around 4 plans outcomes per week. And what that does, it takes in factors of complexity. And just going to Mr. Cromley's point earlier, what we've done with that is to model through time in motion other activities staff do, such as training, quality assurance, team meetings, leave. So we've done a whole range of time in motion study to get to that point. Okay.
So you said, I think, 4 plan outcomes per week. What do you? That's an average, did you say? So yes. In terms of how you communicate that to each planner, what does that tangibly look like for them?
So if you're a planner, say you're in the first planning team, you would be working with the participant from end to end to build, finalise, have the plan meetings, do the follow-up and finalise 4 plan outcomes per week on a 4-week rolling average.
Right.
So that allows for
weeks you've got
that allows for the nuances, swings and roundabouts, levels of complexity, and we monitor on a 4-week rolling average generally.
Okay, and then, but that's only one of your teams, the first plan team.
Yes.
Then there is, I've forgotten their names, but what are the teams other than the first plan?
And so then some of the other teams who might be working in more complex space, they've got slightly adjusted plans. Some of our planners who might be doing plan reviews, they're in a similar range. So there are some different levels depending on what part of the business.
So we've got new plans, complex plans, plan reviews.
That's right.
Any other groups?
We have remote planning teams. They have a slightly lower performance expectation because of remoteness and travel. So there are some sliding scales we use.
So we've got 4 plan outcomes for the new plan team. And then what does it look like for the complex planning team?
Can I take on notice some of the specialist areas? Because they don't actually report under me at the moment, so let me take on notice and I'll come back out of session with that.
And just so that I can get an idea, Mr. Porter, when we look at the overall, I think it was 9, what was the official?
9,840.
9,840. Of that number, how many are planners?
I don't have the numbers, Senator Steele-John, for next financial year. We're happy to take that on notice and provide it to you when we've set our budget allocations.
All right, but for the financial year that we've just concluded, so 20...
Bear with me a moment and I'll find the data. Senator Sheridan, we've got, as at March 2026, 3,608 planners who work across our regional service delivery group and some of our specialist mainstream scheme interface teams, aged care and hospitals, complex support needs, home and living planning, national early childhood and participant safeguarding.
Right, so the total is 3,608.
That is correct. That is in addition to a range of other specialist service delivery functions and NCC. And I'll provide you with those figures on notice.
Thank you. And so of that total figure, how many are within the new planning team? Or were within the new planning team in the year that you've got data for? So because Mr McNaughton, if I might have misunderstood your categorisation, but we've got the new planning team, we've got the complex planning team, the remote planning team, and there was a fourth one.
Something else. Senator Scott, those numbers that Mr Porter said are our existing frontline planning teams.
Yep.
They're not our new support needs assessors.
No, not the new assessors. So just what existing frontline team. So have you got a breakdown for us of that 3,608 number? How many are within the new planning team? As in new plans. They're in the team of planners that deal with new plans with the KPI.
Oh, we'd have to take that on notice. Yes.
Okay.
Because what teams do, we will move those resources around depending on what the pipeline of first plans is.
All right.
So depending on how many access decisions made, how many staff we have to have in first planning teams, so we will adjust that from.
All right. So if you could take on notice for us a breakdown of, we've got the previous financial year where you told us we've got 3,608. If you could break down for us within those. Of that number, how many were within the new planning team? How many were in your various planning teams?
We'll have to give you averages, Senator, because it's not a
static figure.
It's not a static figure.
Average is a good place to start, and then if you could give it to us for the financial year to date, so that we can see what the average was then, what the average is now. Perfect. Thank you. Not many more on these. The KPI for the new planning team, Mr McNaughton, with four plan outcomes being your average over a 4-week period, did you say?
Yeah, we do rolling 4-week period.
So when was that KPI set?
I'll get the exact date for you. It was about this time last year, maybe a little bit earlier, but I'll get the date for you.
Okay. And does that KPI change over time? Is it?
We haven't changed it since we set it for this round, but it is always something that we are tracking and monitoring to see if there's any adjustments that may be needed, but that's been fairly static for the last 12 months.
Okay, thank you. Mr Porter, what do you expect the effect of the proposed NDIS reforms will have on workload? Have you done any modelling around that?
I'd probably refer to the Secretary's evidence and note that as part of the budget process and the development of the business case, there was a range of factors determined that ultimately led to the budget measure and that 800 or so ASL that was allocated to the agency.
Okay. Could you provide, or just wanted to check, is any core work currently done by external labour within the agency?
I can take what we have as part of when we say core work.
Yep.
It's a broad term, Senator. We do have outsourced partners supporting some elements, so our National Contact Centre. Serco. So we have a hybrid model of internal source staff, APS staff who do the more complex work in the National Contact Centre, and we use Serco. I still classify as core work, engaging with participants, answering general inquiries, doing access requests information is still something they do.
Okay, so if you could take on notice whether any core work is currently being done by external labour, and if so, what it is for us, and also if you could provide on notice for us the number of labour hire staff by division, location and role within the agency. Thank you.
Sure.
All right. So that is, I think that'll be it for the NDIA. I'm really sorry for the Commission. You're lucky last on my list this evening. Senator Askew really wants us to go till 11, but I'd like to go home. So I'll
We are in your hands.
I'll constrain myself. Yes, I think it's rather the reverse. Okay, so for the Commission, what is the current complaints backlog for the Quality and Safeguards Commission?
Thank you, Senator. Rod Carra, NDIS Quality and Safeguards Commission, Deputy Commissioner. So in the year 2024-2025, we received 34,775 complaints. So we've had a significant increase in that year. In terms of the backlog, we've been working through bear with me.
So just to clarify, so that was your number for 24-25?
That's correct, yes.
And what was your backlog within 24-25?
It was around 21,000.
Chair, just while we're moving on this, I'm conscious it is quite late and we have a number of officials here from the NDIA. If Senator Steele-John and other senators have finished questions for NDIA, it may be that we could release those witnesses.
I think that would be a very reasonable thing to do.
What an excellent idea.
It's a superb suggestion. Yes.
Chair, just before
you can stay if you would like, Mr. Head.
Yeah,
I probably will.
You're more than welcome.
Since I have nothing else to do at this time of night. Just before the NDIA staff go, it's Sam Porter, our COO's last day at the NDIA today, a long last day. He's leaving the Commonwealth for new adventures in a different part of the world. So I'd just like to put on the record his excellent work as COO in the agency over the last 3 years. Very well respected, and he's been a very energetic COO and a great support to me in my first few months in the agency. So thank you, Sam Porter, and good luck.
Thank you, Mr. Porter. We do really appreciate all your time. And all your contributions to the estimates process. And we wish you all the very, very best into the future.
Lovely.
But we will now release the NDIA, so happy Friday. It's the quickest I've ever seen them leave the room. Will we continue?
Yes,
please do.
I just, Chair, can we without the Minister in the room? Is that?
I think she's sort of in the room.
Just for the record, it's not that she's left. It's actually that she's just saying. Thank you, Mr. Porter, I believe, at the door.
Oh, Lord.
So, yes.
Perfectly capable of answering questions without me. I just wanted to say goodbye to Sam.
No, of course. Oh,
Senator Steele-John, please.
Superb. Okay.
On you go.
All right. Okay. So I've rather lost my place of where we were. I'm sorry, and I can't. My eyes at this time of night, I can't read your plaque. Would you be able to?
Sorry,
just,
Rod.
What was your name?
Rod Carraher.
Thank you. I didn't realise till right now just how bad my eyes are. But okay, Mr. Carraher. So you were telling us the number of complaints for the financial year 4-5, 24-25, and they were
34,785 received.
And then at the end of that, at the end of the financial year, your backlog was
approximately 21,000.
Right.
And we have put on additional staff to deal with age matters. and throughout this financial year, we're in the process of assessing and closing those matters. And in this current financial year, we've got approximately about 11,500 complaints that have been are still to be finalised.
Okay, so the number has gone from 21,000 to 11, but in that period of time, from the end of 25 to where we are now,
yes.
How many did you receive?
So for up until the 31st of March, we've received 20,651.
Okay, so up till March.
Yes.
So from June of 20. Yes, sorry, from the beginning of that financial year to March.
Yes.
You got 21,000.
Yes.
And so when you tell us that the backlog is now 11,000, that is that takes account of the complaints that you received in that window from June to March, where you received that 21,000.
Yes.
So you resolved that in the mix for the eventual 11,000 figure that you've just given me.
Yes, and the prior backlogs were prior to 7th of July 2025.
Yeah.
So that 21,000.
Prior to that point. So when do you expect the backlog to be cleared?
So as part of the process for addressing the backlog, we've got a couple of measures in place. We will have some additional staff working on that backlog. We're also, at the end of this month, going live with the new data radar system, which helps us better analyse and assess those complaints in a more effective way, which will speed up the process. So as part of the process, we will be looking to try and clear those matters as soon as possible. I couldn't give you an exact date of when we will do that.
Okay. And can I just clarify, when we talk about complaints as being unresolved or part of the backlog, so the 11,000, does that mean that there are 11,000 complaints that have not yet been? Have they been engaged with at all? Have they been?
They will have had an assessment of safety and risk to participants. So they will have an initial assessment, but they won't have gone into the detail of full assessment and through to closure.
And they are assessed. They're given an initial assessment, and then based on that assessment, they are categorised.
Yes, and we've introduced the regulatory risk prioritisation model, which enables us to push through higher risk matters through for compliance and enforcement action or safeguarding. So matters that require safeguarding action are referred to our safeguarding team as a priority.
Okay.
Senator, we also receive complaints that relate to people's packages, their plans and other issues that is the agency's responsibility. So part of that process is redirecting those and we would send those through to the NDIA. Okay.
So that I can understand that what we actually have in this 11,000 backlog, so they're assessed, they're given a kind of initial assessment, was how you described it. What does that tangibly look like? What does that tangibly look like?
It's a fairly light touch in terms of looking at the participant safety risk and then looking at, I guess, risks of breaches of the law and those sorts of things that would mean that they needed to be dealt with more urgently than some other complaints.
And a person does this assessment? Yes. And when we say light touch, what do you mean?
I mean that they're assessing that the participant doesn't have an immediate safety risk that needs to be dealt with, or there isn't a serious breach of rules or neglect or abuse that comes through in those complaints.
And how is that done? Is the complaint packaged up in a document? The document is opened and read, or how is that done by the staff?
Yes, correct.
So, just so that I understand, so the staff member opens a file up, or what does it?
Well, complaints come to us in a range of ways. So complaints come through the contact centre where they will hear a matter. They'll push that call through to our complaints intake team. Complaints can come in through emails. Complaints can come in through the web forms.
Okay.
So we take them in those probably three ways are the most common ways we receive complaints.
Okay.
And through those processes, there's that initial assessment that we undertake. And if there are serious matters that need to be dealt with, particularly safeguarding matters, they will go to our safeguarding team, who will then engage with, it could be state and territory, other supports in states and territories. It might be police, it could be a range of other services that this safeguarding team would engage with in relation to that participant.
And are they given they're given an initial assessment, are they then placed in a certain category? So you've talked about them being moved to the safeguarding team, but before they end up in even being transferred in that way, are they given a certain designation, or?
They're not at the moment, but they will be under the new system in terms of how we categorise those and move them through the regulatory risk prioritisation model.
Okay.
But they're not at this stage.
Because they're not at this stage.
No.
So at this stage, how are they handled administratively?
It's a staff member's assessment of the risk that the complaint presents.
Right. And then the staff member is responsible for forwarding the file, or?
Within the system, so it's moved from, we have a Tier 1 and a Tier 2 assessment, and then if at Tier 2 there's a decision made that it requires regulatory response, then it goes through to a panel who assess those matters, and then it would be pushed through for regulatory compliance if required. Okay.
So at the moment, I'm kind of getting a picture here of why the backlog would have been so large. So of the 11,000 that you've got, how many of them have been assessed as containing a risk that means they would need to be moved to the safeguarding team?
They will be the ones that haven't been assessed, haven't got that risk.
So none of them in that 11,000 bucket have been assessed as having
immediate safeguarding or that serious non-compliance.
Okay. Can you provide us on notice, because it's so late, but can you provide us the framework or the policy documents that guides that assessment of risk, so that we can have an idea of that? Sure. So there's the immediate risk. I hate to be blunt with you, but just so that we're clear, are we talking about a categorisation of risk? So we've got immediate risk, medium risk, low risk, or?
So the risks that we assess against are, in terms of, so there's serious significant impact on safety and wellbeing and human rights is one criteria. We look at contraventions, breaches of legislation and rules, and then there's the priority strategy that we're looking at. It depends on if there are matters that we consider. For example, in the last 12 months, we've been looking at mealtime management and dysphagia matters and those sorts of things where participants have been at high risk, and those sorts of things will be also drawn out through that assessment.
Okay. And so what you've told us is that in that 11,000, there is none of the complaints are in the first category.
I'll take that on notice, but my understanding of the process is that that's the assessment.
Yeah. Okay. Could you take on notice to give us a breakdown of your backlog as described, the 11,000 by those three categories that I believe you've stepped us out for, and I'd like to know the average and the median of the amount of time that people have been waiting for a response for what you used to describe as first initial contact or something.
Okay.
Do you use the same terminology now? It's been a while since.
The initial contact or engagement, yes.
It's the one that's not the automatic email reply that you get when you submit the...
Yes.
So not that, the actual time a person... What do you call it now when an individual actually reaches out to the participant?
Normally we've got a specific name for it, but I will find that out.
The check-in, is it?
Yes, we can call it that, yes.
Oh yeah, if you can tell us what the time, the average and median time people have been waiting for that contact, that would be really useful. Now, in terms of the staff complement of the Commission, how many staff have you currently within?
We also gave Senator information about this morning, but I'll just look it up again. I think it was
you've got it already?
957. I might be slightly wrong there. Just a tick.
And I think you've already given that to Senator Askew, so that's great. All of those, how many of those staff are allocated to the complaints backlog? We're nearly done, folks.
Stop teasing us.
No, I'm so close to the end.
Senator Laura Sham, Chief Operating Officer. We only have the breakdown of allocation for the divisions. So within our complaints and engagement division, there's 265 staff. Not all of them would be working, though, on the backlog matters, as Mr Carragher mentioned. There's some dedicated staff related to that, which we can take on notice. But particularly around, we can give you a bit of a breakdown of what staff are working on the tiers, which we described around the first line of assessment and then escalation through to the regulatory process where required.
Okay, so within your different sections or different types of staff there, have you got different KPIs for those working within different areas, or is it one KPI across the whole? In terms of, to be clear, I believe there's a KPI of how many complaints, a complaints resolution KPI on people within the complaints handling team. Is that correct?
For individual staff, how many they need to...
Yeah, how many they've got to get.
No, we don't have that.
Okay. Do you have an organisation, I guess a KPI might not be the right word, but a target of reaching, I think, is it 70% complaint resolution within a certain time frame? What's the time?
70% within 90 days.
Within 90 days.
Performance measures.
And that's your performance measure. So do you believe there are additional staff needed to reach that target, or do you feel you're now staffed at an appropriate level to get there?
I'm happy to start with that. I think a really important piece of this, Senator, and the really good questions is to look at our systems issues. So this is why DART is so important to us, because, for example, many of our staff currently have to manually input data to this work, and DART will assist us to have this populated and will enable staff to actually spend more time on doing, I think, the critical work that you're talking about, as just from putting things together. And this manually, this is also the case when we're looking at perhaps more complicated issues and where there might be a particular safeguarding needs. Our systems across the agency don't intersect, and that means that staff have to manually pull out data. So if they want to see what the complaints come in about a provider, for example, they want to see what contact points we've had with this provider, Our staff have to manually do that work at the moment, and Ms Sham is leading the work on DART, which I'm very happy to report. And we had our first internal launching last week of, for example, pre-populating registration, so our staff don't have to go in and do all that. They don't have to go through systems that are disconnected to find these touch points, so their ability to look at something and make a risk assessment will be incredibly enhanced by these shifts and changes. And it might sound like we're focusing on that a lot, but it is a hugely positive frame for us, and it will really help us move forward much more thoroughly in better using the material we have to not just deal with individual matters, but to look at systemic issues across that we're seeing in the market, and to be able to take different sorts of action, or as Mr Karacha mentioned previously, perhaps campaigns of some sort, or look at what learning needs to be there.
Okay, thank you. This is my last question, I think, because I've figured out how to turn 3 into 1. So have you done any projections in relation to potential increased workload as a result of either the legislative reforms more broadly, or the shift to mandatory registration specifically?
Yes, Senator. So this morning I gave evidence around the breakdown of additional staffing and funding that was provided in the expansion of mandatory registration. So one component of that is the ongoing regulatory activities, which we expect to increase as more providers are registered. There'll be more reportable incidents, for example, that they are required to report, but equally our level of oversight and then intervention throughout the registration period, and then oversight and interventions would increase as a result of those providers being registered. As Ms Glanville said, at the moment the new systems that we will be supported through the rollout of DART will really significantly reduce the amount of manual intervention that our staff have to experience every day in all aspects of the Commission's roles, right through from complaints all the way through to taking a regulatory intervention. And so by removing a lot of those manual processes, we expect then to be able to uplift the number of activities that we're delivering in the staffing complement that we have, but also turning our focus to the increased numbers through mandatory registration.
Thank you. Could you take on notice for me, just if you're able to provide information to the committee outlining I think you keep saying, is it DART or?
Data and Regulatory Transformation,
yeah,
DART,
could
yes.
you? Oh, Lord, okay.
Yeah.
Yes, that's, yep. Could you provide us on notice the kind of outline of that programme, or any
yes.
Briefing papers you're able to provide on that, to understand what that change means for the Commission, and what it
yep.
may mean for the people contacting my office,
yes.
and what they can then expect in terms of their experience with the Commission? That'd be really useful.
Yep.
All right, thank you. Thank you, Chair.
Thank you very much, everyone. Appreciate all your knowledge and commitment and stamina. I would like to thank Broadcasting, Hansard and our Secretariat for all the work that they do. Thank you so much for spending the day with us. We will now adjourn.
Thank you.
Thank you. Thank you.